Assalamu alaikum. Good morning. Sabah al khair, merhaba, mayun to all of our guests. Good morning and welcome to this historic chapter in the wonderful story, the Chronicles of HCT, our first InnCuVation Forum. I'd like to extend a special welcome to our very distinguished guests, including Her Excellency Huda Al Hashimi, the Ministry of Cabinet Affairs and future Chief of Strategy and Government Innovation. Of course, Dr. Abdullatif Al Shamsi, HCT's President CEO. Mr. Atif Albraiki, the CEO of Abu Dhabi Health Data Services. Mr. Saqr Alhemeiri, Chief Officer of the Ministry of Health and Prevention, the Chief Innovation Officer. And Dr. Shamsheer, the renowned entrepreneur and Chairman, Managing Director of the VBS healthcare system. This truly is a historic day, and the caliber of speakers that will be coming to you in the next 4 days demonstrates the strength of our HCT's reach into the community to be able to attract people that want to be a part of this exciting forum. And it ties in nicely with the UAE strategy of innovation, which I'm sure we will hear from Her Excellency. The InnCuVation Forum is a unique gathering of industry, government, and academia. And this is unique to the country. Very rarely do you see something like this. And the theme of it is reach, connect, and launch. Everything we do at HCT benefits our students, contributes to student success. And we are reaching out to our industry partners and government. We're connecting with them. We're launching our students into these innovative areas to achieve this. 4 strategic sectors will be highlighted this week, including health, sustainability, education, and emerging technology. This forum is designed and dovetails nicely with HCT's focus on embedding innovation and entrepreneurship in all of its curriculum and its programming. We are not just graduating companies, we are also graduating entrepreneurs, those entrepreneurs that will work with existing small to medium and large companies across the country. They will be entrepreneurs within those organizations. We'll also be highlighting a golden egg in HCT's basket, and that is our 3 incubation spaces in Dubai, Ras Al Khaimah, and Sharjah. Industry will want to come to these places after this week's forum to work with our students, to work with our experts in applied research and innovation. Incubation stems from 3 key areas: innovation, incubation, and venture. And Dr. Abdullatif will be speaking to the roots of this and the importance of this to HCT strategy. This will lead to encouraging youth to embrace the culture of entrepreneurship and innovation. There'll be many dynamic sessions, and we'll be wrapping up with a Shark Tank style pitch day on day 4, where 10 startups will be pitching to the venture capital, Emirati Venture Capital Association. You're not going to want to miss that day. It's going to be fast-paced, and it will definitely lead to an impact and tangible impact for some of our students financially. I'd like to thank the team that put this together, a very strong team, including Dr. Khalid Manars, our Dean of Faculty Affairs and Applied Research, Mr. Nicolo Battio, Bene Nicola, our HCT Executive Director of Innovation and Entrepreneurship, the entire communications department led by Aisha Al-Mahdi, and the steering committee that put this together with Kim, Andy, and Dalal. So I encourage you to reach, connect, and launch your innovation and ideas as we go forward. So at this time, I would now like to introduce our keynote, Her Excellency Huda Al Hashimi. She is the Chief of Strategy and Government Innovation of the UAE government. She is also a very proud HCT alumnus. She obtained her BSc in Business Administration with honors She's had a stellar academic and career path. In addition to her role as Chief of Strategy and Government Innovation, she's also the Assistant Director of General Strategy and Innovation in the Prime Minister's Office. She leads and sets up the operation of the Mohammed bin Rashid Center for Government Innovation. She's also a major player in the Ministry of Possibilities and Government Accelerator. Previously, she was part of the founding team at the Executive Office for the world's first accelerator on rapid delivery of high priority government programs. She's developed and launched key initiatives and projects with such as the Dubai International Financial Center. She's had many government positions, including the Director of Government Sector Development at the Dubai Executive Council. She's a board member of the Digital School, member of the UAE Gender Balance Council and Dubai Women's Establishment. She chairs the Global Innovation Council, and she is a recipient of the Sheikh Rashid Award for Scientific Excellence. She's also alumnus of the London Business School. Her main role today involves steering the national agenda on innovation, ensuring that we are ready to be able to deliver and meet the vision of the UAE government. I am pleased now to welcome Her Excellency Huda Al Hashimi to address today's forum.
Assalamu alaikum wa rahmatullahi wa barakatuh. Greetings for everyone. I'm delighted to be with you today for this session. Let me introduce myself. My name is Huda Al Hashimi, the Chief of Strategy and Government Innovation, the UAE government, but more importantly, a proud graduate of HCT. Today, I'll be talking about UAE's innovation journey, which has been a story of success for the UAE. Innovation has always had a fundamental role in finding solutions to any challenges faced by governments around the world. And in light of the global pandemic and the matters that have been imposed on everyone in the current period, we saw how effective innovation is. It is worth reminding ourselves that since the beginning, the UAE has always been a pioneer in its development journey due to its adoption of foresighting and future planning. Our founding fathers, His Highness Sheikh Zayed bin Sultan Al Nahyan and His Highness Sheikh Rashid bin Saeed Al Maktoum, Allah yarhamhum, set out from the beginning plans and future visions for the country and worked very hard to achieve them. And this contributed to many of the achievements that we see today. Following the same approach, our current leadership continues to position UAE to be amongst the leading countries in the world. As a result of the clear vision and strategies, and also due to the close collaboration between the UAE government and the private sector and academia, UAE has counted many impressive accomplishments since establishment, and now stands amongst the most advanced nations in the world. We have witnessed a major transformation in the UAE during the past 50 years. We went from a limited economy to sectors that support the world economy. From our first participation in Expo in Japan in the 1960s to hosting the World Expo, inshallah, in Dubai in 2021. And from having no roads to, alhamdulillah, reaching Mars. After successful transformation during the past 50 years, today we need to pursue the same momentum in the next 50 years. And that's why our leaders launched the UAE Centennial Plan 2071 and the preparations for the next 50 years. It is a long-term full vision plan that extends for 5 decades after 2021 that will lead our nation to be the best in the world. Very few nations around the world plan 50 years ahead, but we have been witness of the success of dreaming and setting ambitious goals. And in the UAE, the word impossible does not exist in our dictionary. We always strive to turn the dreams into reality. Let me cite an example when one such dream was envisioned in a ministerial retreat back in 2013 by our leaders. And today it has become a tangible reality with the successful story of the Hope Mars mission. That dream triggered the beginning of a vision and strategy for investment and exploration of our outer space and positioning UAE as a leading country in this field worldwide. Long-term visions such as the Centennial Plan serves as a North Star for governments to develop clear strategies and ambitious goals. As can be seen in this roadmap, we have worked on developing several strategies to meet our leadership vision, and those strategies are agile, and strong, and they are designed to complement each other and to include various different sectors. And if we zoom into innovation, ultimately the goal is to position UAE as an open global lab to experiment and ideate. Let me take a chance now to explain a bit about the Advanced Innovation Strategy. The UAE Advanced Innovation Strategy is simple. It is to spearhead our country towards the arena, towards innovation. This is the second edition of the strategy. The first was launched back in 2015, and it focused on the ecosystem. But this version looks at building from that strategy, and it looks at enhancing our mindset, looking at things such as creating, risk-taking, learning, connecting. It then moves on to actually focusing our efforts as big portfolios in global influencers in advanced science, advanced economies, and agile governance. Like the previous strategy, it also looks at 7 main sectors, but these sectors have now evolved into purposes. For example, from clean energy sector to the purpose of green power, from space sector to the purpose of discovery, and from example of transportation sector to mobility. So these mission purpose driven sectors are now going to be the focus of our strategy going forward. But we believe that despite future planning efforts and launching ambitious long-term strategies, the world around us is changing fast, and we must always monitor global trends and best practices and adapt to these changes through innovation while reviewing our strategies constantly. If anything, 2020 and COVID-19 is a testimony towards that. Due to the fast-paced world and the unprecedented changes taking place worldwide, the need for innovation has increased more than ever. Throughout 2020, the Mohammed bin Rashid Center for Government Innovation, alongside the OECD Observatory for Public Sector Innovation, worked together to publish a series of 5 reports on 2020 trends in public sector innovation. The objective of these reports is to collect great examples on how innovation has been used to deal with real challenges, leading to positive results for many societies, and to identify key trends where we can all learn from. Through this work, we found that governments are taking exciting and innovative actions to transform their operations and improve the lives of their people. More than 680 innovations were considered across 90 countries from around the world, many of them captured in this report itself. Let me take a chance now to explain a bit of these trends. The first trend focused on innovation responses to COVID-19, rightfully so, as the report was back in 2020. And it zoomed into 5 key themes that was used to tackle the pandemic and accelerate the recovery. But these themes are also relevant regardless of the pandemic, and it's something that will carry on forward into 2021 as well. For example, rapid acceleration of digital innovation and transformation, compressing many years' worth of technological advancements into a few weeks and months, moving towards a digital virtual government. Other examples of themes such as seeking bottom-up solutions and insights, and this is coming from citizens, academia, students, and businesses, looking at social solidarity and caring, self-activation, mobilization of millions of individuals wanting to help their communities, reducing the spread of the virus through tracking, tracing, and adaptive action, and forging a path to recovery. The COVID-19 crisis, unfortunately, is far from over. It continues to ripple throughout the world. However, governments and their partners have demonstrated the capacity to manage this delicate balancing act and devise ambitious, focused, innovative ideas and solutions under exceptional circumstances. The second trend brought to focus the changes in data and finding the balance between public provider versus big brother. Examples such as data harvesting and monitoring, and more relevant is biometric technologies and facial recognition. His Highness Sheikh Mohammed bin Rashid Al Maktoum only recently announced in a tweet that the UAE government will soon start using facial ID in some sectors to verify the identity of individuals and to avoid paperwork unnecessary delays. This should speed up the process and improve the quality of services, making easier and faster for people to get their transactions completed. So this is already an action in place based on the trend we have seen. And lastly, I wanted to share another key trend, which was the rising need and importance of seamless government. It is very evident that governments need to continue moving forward and innovate ways to provide services to people and businesses. Many governments were able to successfully achieve this, and we have witnessed areas such as invisible government, shifting from making governments an ever-present factor in people's lives to building proactive and automated services. Matrix government, and that is making bureaucratic and sectorial boundaries permeable and bringing together different pieces of society in order to work together to achieve goals. Catching a new wave of civic participation, example, students and academia playing a larger role. And the last theme was on anticipatory government. And this is about exploring scenarios and taking action today to achieve and shape tomorrow. Governments have more potential and more need than ever before to provide incredible and innovative services and solutions to their peoples. Those were just some high-level examples of the trends that show how the world is moving and how we should leapfrog government to cope with these changes. Dear guests, today is the first day of our countrywide celebration of innovation, UAE Innovates 2021. Every year in February, we celebrate innovation as a national event that celebrates all aspects of innovation, from conferences such as these to showcases, exhibitions, announcements, and gatherings to really celebrate it across every single emirate. I'm honored to have been invited to address you all today during the opening of your amazing conference on the first day of UAE Innovate celebration. Youth are the pillars of our nation. It is your role now to lead our nation to the next generation of ambitious goals for the next 50 years. And we must realize that this requires a different way to do the impossible, and yet one that will continuously require innovation to be at the heart of it. Thank you, Your Excellency, Dr. Abdullatif Al Shamsi, for this kind invitation, and congratulations to you and the HCT family for all that you've achieved in this domain. And I wish you all a great and successful conference. Thank you.
Shukran, Your Excellency. It's always wonderful to hear from a very accomplished HCT graduate, and it makes us proud to have somebody in the HCT community achieve what you have. On behalf of HCT, its Board of Trustees, and the entire HCT community, thank you so much for sharing your valuable insights today on the government's commitment and initiatives towards innovation as a strategic component of this country's success. The annual UAE Innovation Initiative is an excellent vehicle to promote and advance the culture of innovation, and we are proud to be a part of that, and very proud to have you open our forum. Your background and career highlights and achievements are an inspiration to all of our thousands of young female HCT graduates who no doubt will be looking to you as an example to kickstart their careers, and I know to kickstart a number of their own companies. And it's your guidance and leadership that takes us to that point. So thank you so much for sharing your valuable time. At this point, I'm now delighted to introduce our leader, HCT's President and CEO, who's become a very good colleague and friend of mine over the years. Makes me proud to work with, beside Dr. Abdullatif, and to hear his fascinating vision. I think the two of us work together well because he has the vision and he says, Alex, go make this work. And it works wonderfully together. Dr. Abdullatif, I really appreciate the opportunity you've given me to be a part of this innovative culture at HCT, and we look forward to hearing more about your fascinating insights as you gaze into the Dr. Abdullatif crystal ball and our implementation of our next strategy. Dr. Abdullatif, the forum is yours.
Thank you, Alex. Bismillah ar-Rahman ar-Rahim, wa salatu wa salamu ala ashraf al-mursaleen. Good morning, everyone. Thank you, Alex, for the nice introduction. And I would like to share with you my quick, and I'll do my best to make it a short presentation. What a better way to start this Innovation Week with the talk from Her Excellency Huda Al Hashimi, Chief of Strategy and Government Innovation at the Ministry of Cabinet Affairs. She lay out the government strategy plan of innovation, how it's been progressing, and what we have today. And we have all witnessed what a perfect example of the Mars Hope probe that was achieved by UAE government just a week ago. How it was a vision, it was planned well, it's an innovation by all means, and it is achievable to make a groundbreaking in the areas of research and science. So what I would like to quickly present to you today, or talk about what we've been doing in HCT and how HCT plugs in what Her Excellency Huda Al Hashimi presented as a government strategy and innovation, and how HCT is doing to play a role in achieving the government vision. So we all know about the HCT Strategy 4.0 was launched by His Highness Sheikh Mohammed bin Rashid during his visit to HCT back in March 2019. And it was based on three main pillars: graduating companies, no Emiratis left behind, and graduating technical leaders. What we would like to talk today, maybe in the short time I want to focus more on the graduating companies and in the applied research, and how can we as a HCT community, from faculty, students, and staff, to convert many of our practices, many of our projects, capstone projects for our students, into a startup, and those innovative ideas, how it's become one of the key sustainable in our economy through SMEs. Plus, I want to highlight some of the key achievements we have launched in the past 4 years in the areas of applied research, and how we plug in many of the projects we do with industry. So with that said, again, the three pillars, it's clear, and we've been aggressively progressing in achieving every component. We have set a very well-planned KPIs. Alex and the team has been working very hard to achieve the targets, and we are making many groundbreaking in many of those areas that we have promised in our vision. Now, the concept of graduating companies started with the 50th charter that was launched by His Highness Sheikh Mohammed bin Rashid, specifically in Article 6, free economic and creative zones in universities. That's a very different, disruptive, I would say, way of how we approach academic institutions, and how do we convert our traditional way of delivering academic degrees and credentials to become creative zones and economic zones to graduate companies and entrepreneurs. So with that, in our as a vision of His Highness, we were able to introduce the concept of the incubation spaces, and Alex highlighted at the beginning, it's about a space where we have an opportunity to innovate through different students' projects embedded into our curriculum, engage with industry, and how do we take those innovative ideas, incubate them to become more of entrepreneurial solutions, and to provide startups and SMEs, and to support that through venture by having partners today with HCT to provide financial support and startup investments. So combining those two under one umbrella, that's where we came up with the concept of incubation: innovate, incubate, and venture. And incubations, by all means, it's a very innovative word itself that reflects this is what we at HCT are doing. So we are not just on providing education to our students, how to become an entrepreneurs, but also and to walk them through the process of entrepreneurs, and to help them to set up their own startup successfully later on. And we are very proud today that we have startups already with the it's been in process for the last 2 years. We are fortunate with Nicola. He's leading this team of incubation with his team to engage students. So we have more than 1,200 students have participated in those different programs. And today we have already launched 67 startups, 33 of them startups led by female students, which we are very proud of. And many of them are already practicing through trades, and they are licensed to do their activities, their trade activities. And the important part is the number of the students' engagement in all this process. My true belief, ultimately, yes, we would like to graduate companies as much as we can and to support our students to have their own startups, but to embed the entrepreneurial way of thinking throughout our courses, curriculum, with our faculty and students, that is extremely important. The mindset of our students to become an entrepreneurs in the future, perhaps not necessarily at the time they graduate, but down the road after gaining more of a work experience to start up their own business, they will be, they are ready to do that. So we are engaging with the Emirates Angels to provide the support, and that's what Alex was referring, that we have the last day of the Innovation Week, where we have students will be pitching up their ideas and to get the support that is needed to have their own startups. This has been a hard work for many months. And we have, through, you've seen in this slide, when we started by inaugurating 3 incubation spaces in Dubai, Ras Al Khaimah, and Sharjah, and how we engage students with their projects, set up the entrepreneurial strategy and develop it. We went through boot camps, and we had many students have participated in that. And then we got with the COVID-19, and we are very fortunate, in fact, with because now this is becoming more and more essential to provide for our students, because we strongly believe post-COVID-19 will require more of startups, and we have to create wealth, we have to create opportunities for our students, and graduating companies is the way to do it, and it is what's been adopted, in fact, by our government today. And then we went through boot camps, accelerators, and to be honest with you, the advantage of the COVID-19, maybe it opened door for many other campuses who do not have an incubation space to participate in those boot camps and accelerators, to be part of those startups, because many of those training and many of those programs we were able to deliver it online. So I think we have put a model together to engage students, and more importantly is to serve the need of UAE industry and society at large. So, and at the same time, we are meeting the national priorities that was presented earlier by Her Excellency Huda Al Hashimi. How do we do that? Through startups, through innovation and applied research. And this is what my second part that I would like to talk about is the applied research within HCT. This is something also we started in the past 4 years to engage industry in different applied research projects with our faculty and the students. And we have, in fact, from day one, we aligned our projects to be with the national strategy. And as you've seen in this slide here, that the national strategy that was presented earlier by Her Excellency Huda Al Hashimi, and the different areas and topics. So we have today, with many projects supported by HCT and our partners from the industry. So we have 32 projects in health, 20 in energy, 2 in space, in education 92, as expected being an academic institutions, and water 6 projects, transportation 8, and we have technology 30 projects. So many of those projects have started in action, and we have our faculty and students, again, in partnership with the industry to serve and to bring solutions to those areas. And just to summarize quickly, within the past 4 years, we have introduced different types of funding for those research or applied research projects, start from the seed funds, interdisciplinary industrial collaboration, and summer undergraduate research fund. So we are happy and proud today within HCT community. We have more than 342 researchers with 190 projects being supported. And during the past 4 years, we have provided the funding for more than 11 million dirhams, and in partnership with many industry to support those projects. And what I'm more proud today to see is that we have many of our students at the undergraduate level have participated in those projects. We have more than 239 students participated through collection of data, through conducting surveys, providing data analysis, and and picking up a very essential research skills as they become part of those research projects. And they have already conducted more than 12,400 research hours. So the research activities, it is beneficial for our faculty, and by bringing HCT to high standards through their publications in the research community, also bringing industry on board, because we're providing help and solutions, problem solving for different projects that is in need in this country through different industries, and also engaging our students and picking up those research skills, which is essential skill that our students should benefit from all those different projects. So with that being said, today we are happy to showcase many of the outcomes of those projects in this InnCuVation Forum, reach, connect, and launch during the next 4 days. We have great speakers, 13 interactive sessions, 12 keynote speakers, very well known in this country, to bring industry into with our students, with our faculty, engaging them in the project that we are doing. We have 55 participants from 20 institutions, inspiring ideas through different sessions, and we have virtual showcasing, and we will conclude by a pitching competition toward the end of this week. And I think this will make really the best platform where we can engage industry, faculty, students, and to be under the vision of the government of UAE to serve the critical projects within the UAE. So I wanted to share with you some of those data earlier, and how important startups, SMEs within HCT, and how it's becoming now part of our culture within HCT, part of the mindset that's been set for our students to become future entrepreneurs. And also I have highlighted some of the key findings on the research activities that we are very proud of, and I think it serves the UAE government as well. So I would like to thank you all for listening, and wish you all the attendance and the next very active 4 days to benefit from all those sessions, engaging with our speakers, especially from the industry, bringing industry on board with us. And I think with the virtual accessibility today has made it an advantage for us to work all together and to bring the best for our students and our faculty. Thank you, everyone, and thank you, Alex.
Shukran, Dr. Abdullatif, and thank you very much for your insightful comments. You know, I was just writing down a couple of notes, and it's nice to see that Her Excellency puts us out there saying the word impossible does not exist. And you followed up with the data to demonstrate exactly that. And for HCT to take on what it has in a very short period of time is a commentary and a tribute to your leadership and the success of the organization you've put together over the last five plus years. I'd be remiss if I didn't welcome a record number of participants that are here with us this morning. I'm just thrilled at the interest that people are showing in HCT. I truly believe HCT has been one of the best kept secrets, but it's been unwrapped. The gift wrapping is off, the bow is off, and we are on display for the world to see. And it's good to see the level of participation this morning. So we are moving forward now into our first session. And I'd just like to highlight a couple of things, reiterating what Dr. Abdullatif says. We do have these 3 incubation centers that are a big part of our success. And, you know, if you're going to work with business, you have to think like business. And there's no finer example than when the COVID crisis hit, the pandemic hit, and HCT stepped up through its incubation centers to participate in developing the multi-purpose splitter designed by our faculty, prototyped within our incubation centers, and Nicola led this initiative with the full support of the entire HCT executive. And that is just an example of where HCT is going. I would now like to hand over the microphone, the screen, to, I've got to read this because this is just great, to the man with the golden voice. I think that's awesome. Khalid, the floor is yours. Take us home.
Thank you so much, Dr. Alex, and thank you to Dr. Abdullatif also for the presentation. I think everybody has seen today the level of the speakers that we have, and although we had to condense the innovation month into an innovation week, that only raised the bar, and it's time to really give you the best of the best in terms of the speakers and the different sectors which the UAE is focusing on and during this time and age. So thank you, Dr. Alex, once again. Ladies and gentlemen, we would now like to kick off the InnCuVation 2021 Forum program as we turn our minds into the first of the forum's sectors. We're going to learn a great deal through 3 inspirational keynote speeches by speakers who you see on your screen right now, leading experts and groundbreaking innovators in their respective fields. I would like to welcome the first of our highly distinguished and eminent keynote speakers in the healthcare sector. And let me give you a brief introduction. Our first speaker will be Mr. Atif Albraiki. He is the CEO of Abu Dhabi's Health Data Services, known as Malaffi. In his current role, he has played an instrumental part in the establishment and implementation of Malaffi, the Abu Dhabi Health Information Exchange. Under his leadership, Malaffi became known as one of the fastest rolled out high health information exchange globally, and the first platform of its kind in the Middle East. Prior to joining Malaffi, Mr. Albraiki was the Director of Strategic Projects at Injazat, where he was responsible for developing and incubating strategic public-private partnerships. One of those partnerships was called Hassantuk, where he was the General Manager in a private public partnership between the Ministry of Interior and Injazat. His areas of expertise are in health information exchange, partnerships, patient safety, digital health transformation, and healthcare data security and standards. Without further ado, please welcome Mr. Atif Albraiki, who will discuss innovations in the expansive fields of healthcare, health information, and data security. Mr. Atif, the floor is yours.
Thank you. Thanks for the introduction, Khalid, and good morning, everyone. I'd like also to thank the Higher Colleges of Technology for giving me today the opportunity to speak to everyone in the webinar today. So as Khalid said, I would walk you through the journey of Malaffi, and which is one of the key digital transformation project that is taking place currently in the Emirates of Abu Dhabi, and really tackling the data angle of innovation. So if you look at the healthcare industry globally, there is a lot of data that is already available today in various platforms. One of the statistics was talking about 25,000 petabytes of data that's already available today from various systems globally in the healthcare industry. However, one of the biggest challenges of having data that is fragmented and siloed is that you don't get the full power of what the data can provide you in terms of enhancing the quality of care and improving the coordination that can happen between the different stakeholders who are providing services to the ultimate patient. And as one of the statistics from the Joint Commission was saying that 80% of the serious medical errors are actually due to miscommunication between healthcare providers, especially when a patient is being transitioned from one healthcare provider to another healthcare provider. And really having this, let's say, siloed environments of pockets of data is not helping the patient, who is ultimately the person that all the providers want to serve at the end. And if you look at the various other challenges that the healthcare industry today is facing, not particularly in Abu Dhabi, but even globally, the increase of chronic conditions and chronic diseases, mainly due to the change of lifestyle, specifically also in the last 30 years. And the not integrated systems are causing a lot of overutilization of healthcare services, and which then contributes to rising the cost of the cost of healthcare in different healthcare systems. And instead of putting that cost in further improving the healthcare, it is being consumed in overutilization of unnecessary services. In addition to that, it's adding also a lot of challenges to the healthcare regulators in doing system planning and capacity planning for the healthcare sector. And if we look at the healthcare sector in the Emirates of Abu Dhabi, there was a major transformation or healthcare reform that happened 15 years ago with the introduction of healthcare insurance around the time frame of 2005 or 2004. And that really played a key role in improving the quality of care in the Emirates of Abu Dhabi and increasing the level of access, where patients are being given options to go to robust healthcare infrastructures that we have here in the Emirates of Abu Dhabi. And we have seen that improvement in the quality and the outcomes of the patient in the last 12 to 13 years. But one of the biggest challenges that the healthcare sector was facing is that there was a lot of fragmentation and different healthcare systems that are not connected with each other. And the Department of Health, they realized this problem, and they were looking at ways of how technology can really help in solving this issue and integrating the healthcare system for the benefit of the patient. And that's where the initial plan or project of Malaffi started around 2007. And we're currently, I'm going to walk you through the foundation that was built. And this or such platform is a key foundation, to build a robust platform that can further enhance or enable various digital health initiatives and utilizing the data for improving the quality of care. So one of the key mandates of the Abu Dhabi Health Information Exchange, or what's known as Malaffi, is to really integrate different stakeholders who are working today in the healthcare sector in the Emirates of Abu Dhabi. So that's being different hospitals, clinics and centers, pharmacies and diagnostic centers, and even public health department that is overseeing and is playing a key role in ensuring this, the healthiness and the safety of patients in the Emirates. All of those stakeholders, it's key for them to be integrated along with the patient who's receiving the service. And the idea of the platform is to really integrate at real time with all the electronic medical record systems that are being used across all the different healthcare facilities, being it public facilities or private facilities, being it hospitals, clinics, centers. All of them, they have different electronic medical record systems, lab information systems, pharmacy management system. All of them are contributing the data at real time to a central platform. And this platform then is giving them a unified view of the complete medical record of the patient across the Emirates of Abu Dhabi. And that is achieved through various key components. So this platform has an exchange platform that connects all the data at real time from all the systems that are today siloed across the Emirates of Abu Dhabi. It then provides a unified view of the medical record of the patient for any healthcare, for any healthcare provider that is today involved in treating that patient, with putting a lot of controls at the privacy of the patient and ensure that the data is secured and only accessed on need basis. And currently we're working on providing this view also to the patient themselves through various digital channels, and at the same time providing insights to the different stakeholders at patient level and population level to really drive better public health and population health programs. And if you look at the value or the data elements that are available today in Malaffi or in similar platform, it includes the complete demographics of the patient, all the encounters or the visits that the patient has had across the Emirates of Abu Dhabi, all the problems and diagnoses and allergies and lab results that have been captured in different siloed healthcare systems today in different facilities, all the medication that the patient has taken, the previous procedures that that patient has had, and the clinical notes or the discharge summaries that the providers have provided for that patient. And if you look at where are we today in the journey of Malaffi, this platform was launched by the Department of Health in January 2019. In very, very short time, with the great support that we have received from all the providers that are today working in the healthcare sector in the Emirates of Abu Dhabi, and with the guidance and the direction from the Department of Health, we're able to accelerate the program very, very fast. And today we have 85% of the hospitals in Abu Dhabi already connected, 58% of the clinics and the centers, and that constitutes to around 87% of the claimed medical episodes that are happening today in the Emirates of Abu Dhabi. And you can see in the screen various statistics that really shows the robustness of the platform, and that this platform has proven its value by connecting different technology systems that are today scattered across different healthcare facilities. And the best way to look at the outcome is really to go to ask the end users who are today seeing the patients. And one of the best clinical testimonials that I like to share usually with the different users is what I heard from Dr. Maria from NMC. She was seeing a lot of patients during the COVID-19 pandemic, and still continuing to see a lot of patients who are coming with symptoms. And as per the guidelines, in some cases, she has to do an X-ray for those patients. So it was very important for her to see the previous test that this patient has had. And through Malaffi, she was able to really, in certain cases, reduce the unnecessary X-ray that she was providing to the patient. And she gave us a statistic saying that 30% of the suspected cases, she was able to avoid the X-ray for them. That really helped in lessening the radiation that patient is receiving, so improving patient safety. Looking also at quicker diagnosis, so improving the patient experience and the quality of care, and really helping in reducing the quality of care by avoiding unnecessary tests. And there are many other clinical testimonials that can show the value of the platform. And such platform really improves as the time goes on. So as we connect more healthcare providers and as they contribute more data to the platform, more return of investment is going to be seen by the different stakeholders who are already connected to the platform. And one of the key use cases or the value of the platform that was seen is during the COVID-19 pandemic at the healthcare sector perspective. And before I go into the details of that use case, in 2019, we started looking at the data that we started receiving in the system, doing a lot of exploration of what value can this data provide to the public health department. And during the pandemic, we were able to provide different descriptive insights. So looking at, let's say, historical trend that is happening today in the sector. Also work with the Department of Health in providing them data so that they can do more predictive analysis to look at the spread of the disease. And in the future, we're looking at more prescriptive data analysis that can be provided from the data that we have. And the key example is the way that Malaffi was able to consolidate all the data into a single platform. So all the PCR tests, all the vaccinations today are coming through a central platform, where then we provide different data feeds and dashboard to different stakeholders who are involved in providing and coordinating the care in the Emirates of Abu Dhabi or across the UAE. So it provides insights about the spread of the disease, the number of confirmed cases, and different KPIs that can help the regulator coordinate the pandemic response across the Emirate. Looking also at the immunization and the national immunization program that is going today, and linking it with different data elements, being it PCR test, a previous medical condition of those patients, and provide them insights about this program and how they can improve the immunization program across the Emirate. At the same time, we looked at the data and started providing predictive analytics at the population health. So, looking at the historical data that we already have captured in the system, can we predict patients who can be high cost in the future, or who can develop a chronic condition like diabetes or kidney disease, and really provide early intervention to avoid any future diseases for those population. So these are just examples of how innovation can play a key role, utilizing the data that's already available, scattered, by combining it into one single platform and providing different use cases. And the opportunities are a lot, being it using the data to provide additional use cases to the end users, or even using different digital technologies today to transform the way that healthcare is happening. And I just wanted to shed light on one aspect of data and how we are using today the fragmented data to improve the quality of care. Thank you all for listening, and I wish you have a great day. Thank you all.
Thank you so much, Mr. Atif. And I think going back to Dr. Abdullatif's comments on applied research, a lot of our faculty are really excited to be or to see that data consolidation and data sharing is something happening on a nationwide level, and being able to access that data and really create groundbreaking research in terms of the UAE's future in various sectors. So thank you very much. I'd like to thank you for providing us with your insights for these homegrown innovations. And we are delighted to have you with us today to provide these valuable comments and perspectives. And for the final thing, we're looking for a lot of collaboration opportunities with Malafi as well, in terms of HCT and our faculty being explored in the near future, inshallah.
Thank you, Khalid. Looking forward to that.
Thank you so much, Mr. Atif. It is now my pleasure to welcome our second distinguished keynote speaker in the healthcare sector, Mr. Saqr Alhemeiri, the Chief Innovation Officer at the Ministry of Health and Prevention. By way of introduction, Mr. Saqr has an extensive background building and administering programs across all organizational levels in the private sector, including utilities, commercial operations, and retail sectors. This includes working for Emirates Airlines, implementing a comprehensive learning and development strategy for Majid Al Futtaim Retail, and driving strategy at Dubai Electricity and Water Authority. I am also excited to welcome Mr. Saqr on a personal level as a fellow graduate of the UAE's Government Leadership Program, where he has been invaluable in sharing the country's experience in service excellence with countries and governments in the Arab world. Please welcome Mr. Saqr Alhemeiri to discuss the many innovative processes being implemented at the ministry, which are extremely vital, particularly given the current environment the world is placed in. Mr. Saqr, the floor is yours.
Thank you very much, Khalid, for the introduction. It is with great pleasure that I join you today with your distinguished set of speakers, and in this outstanding event that I'm very happy to join today. What would I like to talk about today is the Ministry of Health and Prevention journey with innovation, and maybe share with you a few of our projects that had actually made a difference in the field of healthcare. As most of us are aware, when the government launched its national agenda for 2021, it had a great focus on innovation to understand that us as a government and as a country, we critically need innovation to survive, but not that wasn't our main focus. Our main focus was we critically need innovation to strive, as we are setting ourselves to be number one in several fields, including healthcare. Ever since the UAE National Innovation Strategy was launched, we have worked continuously in improving the climate of innovation in the healthcare sector. That includes creating a strategy that will effectively be implemented in order to come up with a project that will have a real impact and an actual return on investment for the healthcare sector. Now, in order to have that early strategy as a success, we worked really hard to include our
Mr. Saqr, your mic is on mute. I apologize.
Can you hear me now?
Yes, we can hear you. Please go ahead.
Okay. Yes. So we've worked very closely with our stakeholders, universities, companies, medical equipment companies, pharmaceuticals, the public, and our patients to come up with a strategy and create a shared responsibility towards achieving this strategy. This resulted in over 100 initiatives that was transformed into project, and it covered all the themes of the healthcare sector, whether it was the enablers, where we're covering the human capital, IT infrastructure, budgeting, knowledge management, or the intervention side of the healthcare sector, which is happening in our hospital, or the prevention, which is happening in our clinic, in addition to focusing heavily on research and development and improving our processes and procedures administratively as well. Now, that being said, what are the main tools that we use to manage our strategy for this? We came up with a platform called Afkari. Afkari is not a traditional ID management system. It's actually a total innovation cycle management system. So we use this system to create IDs and then transform them into actual implementable projects, and then incubate them and escalate them, and then implement them, and then share them with our partners. Up to date, we've came up with over 12,000 IDs, implemented approximately 4,000 of those with different level of impact in the Ministry of Health and Prevention. Many of our very successful IDs happened with partnership with the private sector, semi-private sector, and other government entities. Now, one of the basic tools as well that we are using in order to make our human capital capable in terms of innovation is our learning management platform, which is called Maharati. This is an innovative platform that we have developed across the years to implement it with an AI and machine learning aspect in order to ensure that all our employees can create their development plan and find their way in growth in a personalized way. In terms of innovation, we have several tracks for innovation. Our employees are approximately 11,000 employees. 10,000 of these employees have gone through the basic innovation trainings, and around 3,000 of them have evolved into an advanced level of innovation capabilities based on the machine learning and AI input that these are the most susceptible to learning innovation and implement it. One of the other unique projects that we continuously work on and develop in the Ministry of Health and Prevention is utilizing behavior insight in order to create a culture of innovation. Using nudges, behavior nudges, to ensure that we are able to motivate people to get into innovation. One of these techniques may be basic incentive techniques, but others use as well as something that to do with competitiveness, where, for example, we send out an email comparing different hospital or different entities and their innovation level. And we've seen a great result based on that, and we are planning to publish a paper soon based on the effectiveness of behavior insight and nudges in creating a culture of innovation in the healthcare sector. Another thing that we do to improve our employees' capability in terms of innovation is creating a long-term innovation leadership programs. Now, we focus mostly on the youth with these because the millennials are mostly interested in going through untraditional programs that will be effective with a higher rate of return. So one of the programs that we have designed is an experiential learning program, which takes the participate into actually an experiential learning type of thing, which goes like skydiving or camping or hiking. And through those experiences, they start doing group exercises where they learn several things. Now, when we launched this program, it has been interrupted with the challenge of COVID-19, and still we will be able to transform it virtually and successfully do it in a very untraditional way. And having a very good set of graduates that are today leading a lot of community of practices in terms of innovation. We've also launched the UAE Healthcare Innovation Award, which had its first cycle last year, and we're planning to repeat it every couple of years. And it has different categories like hospitals, doctors, nurses, clinics, and so on. Finally, I just want to share with you one of our main events for this year that we have launched yesterday. It's a global digital healthcare hackathon. During the launch yesterday, we had 600 participants from 28 different countries that are working in 56 groups that we will hope to have outstanding ideas and projects from that we can implement in the UAE. Our innovation journey is just starting. I don't think 5 years has been enough for us to make it part of our daily practice. However, we've witnessed during the COVID challenge that many of our employees, they would innovate on the spot to close the gaps without going back to the traditional system of getting approvals and so on. One of the very basic examples of that our dentists, for example, they have a 3D printer to print veneers. However, during our shortage of face shields, they were able to immediately start printing face shields for themselves and for other colleagues. What we are planning to do going forward is working further on our partnership. We understand that more diverse ideas create a better projects that we can take forward to further improve and implement a new project. And we look forward to our next strategy for the 2071 and what it will also bring us. Thank you very much.
Thank you very much, Mr. Saqr, for your address today and for sharing with us these actionable points that we can all have in our organizations with regard to innovation. A big thank you also to the work that the Ministry of Health is undertaking to keep the UAE citizens and residents safe through a high level of professionalism and transparency. We must also note the wonderful efforts the ministry is integrating the HCT students and graduates in its rank year by year. So thank you very much for that.
It's a pleasure.
Ladies and gentlemen, for the final keynote speaker for today's triumvirate of exceptional speakers, needs little introduction due to his remarkable work as a physician, as an entrepreneur, and as a philanthropist. It's now my pleasure to welcome Dr. Shamsheer Vayalil, the Chairman and Managing Director of VPS Healthcare, to give the third health keynote address today. To give you a picture of the person Dr. Shamsheer is, let me share with you a little bit of his background. He is the founder and Managing Director of UAE-based VPS Healthcare, which has 24 hospitals and over 125 medical centers in 4 countries, and a US FDA certified pharmaceutical production facility in Dubai. He is also the Vice Chairman and Managing Director of UAE-based Amanat Holdings, the region's largest healthcare and education investment company. He is a member of the Giving Pledge and is actively engaged in numerous economic, social, and philanthropic initiatives. He is also a member of the following institutions: the UAE Medical Council, the UAE University Advisory Committee, the University of Sharjah's College of Medicine Advisory Committee, and the Kerala NRI Commission. Please join me in welcoming Dr. Shamsheer Vayalil, who will share with us some remarkable insights into his observations on healthcare innovations and the healthcare sector. Dr. Shamsheer.
Thank you, my friend. Thank you, Excellency Dr. Abdullatif Al Shamsi, President and CEO, Higher Colleges of Technology, and the organizers of the InnCuVation Forum for inviting me today. We are proud to support HCT, which is helping us achieve an important objective for the UAE and for the region. As some of you may know, we started our journey in 2007 with a simple idea and a deep ambition. I came in as a radiologist, worked for a year, and then had this desire to do something that can affect the lives of people. As a radiologist, I didn't want to be confined to the basements of hospitals. So I thought I'll come out and see some light, and believe me, the air in UAE has got something to promote your entrepreneurial instincts. And with that one hospital, now we are a network of hospitals. We have a FDA certified manufacturing facility, and we believe in the integration of healthcare. And this can only happen with technology. The healthcare, as we know, is changing, and I would take it into two levels. One is pre-COVID and the other one is post-COVID. We were always talking about disruption, but today we are riding the cusp of technological wave that promises to create an array of patient-centric services that will disrupt almost every aspect of healthcare, from delivery to devices to pharmaceuticals and everything in between. Healthcare was never one size fits all, and COVID has brought this fact into a sharp reality, with individuals and geographies handling the toll of this prolonged pandemic differently. The world faces complex challenges in healthcare: how to avoid preventable deaths from infectious diseases, how to address the slow motion, non-communicable diseases epidemic, or how to provide therapies to the developing world to meet the ever-increasing financial demands. All are driving the huge demand for care and will impose an almost unmanageable disease burdens next decade all over the world. However, everyone still needs access to timely, accurate information and a better understanding of the care options they have, with a safe, easy way to see physicians and monitor chronic conditions. As you all know, some of the technologies that took a leap is things like telemedicine, teleradiology, teleconsultations. So these are all changing the conventional healthcare delivery concepts. How long does an innovation really take in healthcare? As a benchmark, it takes an average of 12 years to develop a new pharmaceutical drug from bench to market. Other new technologies and methodologies in healthcare may also take years and several millions or billions of dollars before they are ready for public use. That is under normal circumstances. During the pandemic, we saw countless researchers, engineers, clinicians, every walk of life, patients, nurses, citizens, scientists, are applying their diverse skills as data analysts, developers, mathematicians, psychologists, designers, and makers toward the same goal of saving lives. Although not all ideas worked, but the motivational efforts are helping foster rapid iteration of innovation development. The urgent dynamic of the pandemic have forced healthcare organizations to refocus and adapt in various ways, leading to mixed results. In any case, healthcare industry has become a bit slow to embrace the digital revolution than others. Here we are thankful to people like Malafi, and every industry, every ministry has got a chief innovation officer, which keeps that entire environment ready for innovation. In healthcare, as my friend Atif mentioned, the silos are the biggest issues. So we need to break these self-created silos, which creates confusion, errors, redundancy, and missed opportunities and a lot of waste. There are data security and privacy concerns, along with massive increase in quality and efficiency. And as I said, the move to virtual delivery rapidly advanced the adoption of some technological innovations like the wearable health devices that had already started transforming the healthcare experience. The data from these sorts of devices can empower not only the patients, but employers and caregivers. For example, organizations have created new predictive models using artificial intelligence to analyze data related to the well-being of the entire community, forecasting when an individual might become diabetic or develop other serious complications 5, 10, or even 15 years in the future, and enabling early intervention. The challenges the developing world faces are also its greatest potential. They don't need to wait and build the last 200 years of industrialization. They can leapfrog a generation of change to build health systems of the future rather than of the past. Some of these innovations have transformational power to change a generation. The development of coronavirus vaccine in approximately 300 days was a huge and unprecedented global achievement. And just a few days ago, British Prime Minister Boris Johnson proposed cutting length of vaccine development to 100 days, which is unheard of. It is clear that the disruptive innovation driven by technology in healthcare is real and gaining traction. Some of these innovations will address niches, but others will have broad adoption. Healthcare innovation can develop at unprecedented speed when individuals focus on solving the real-world problems and collaborate with cross-functional teams. Anyone can innovate from anywhere. It could be the biggest disruption can come from HCT. We never know. Digitization will move healthcare from the break-fix model of medicine to the predict and prevent model. Digital health technologies and the likes of IoT will perhaps be the most disruptive and innovative of them all. These disruptions will perhaps not come from the traditional healthcare verticals and may lead to high productivity improvements that have eluded us so far. As an example, we at VPS, we serve more than 10,000 patients every single day, which we believe is a goldmine for big data. Millions of patients could benefit from genetic testing before prescribed common medicines. Researchers have found that in more than 1 in 5 occasions, there was a potential for a doctor or a pharmacist to take the action under international pharmacogenetic guidelines. If this screening was applied to all new prescription, an estimated 1 in 11 would lead to change of drug or dose. Better selection of medicines based on patients' genetic information could mean less side effects and better treatment outcomes. All what we are talking is the future is for precision medicine. A lot of side effects of these medicines and reduced hospital visits could be the best outcomes coming out of all these innovations. It's actually related standard ecosystems. In most areas, this happens from innovators outside the system. But we are proud to say that our clinician teams are using innovative platforms to deliver better outcomes to the patients. Last week, our surgeons from Brazil Medical City joined 15 surgeons and from 13 different countries to perform 13 mixed reality orthopedic operations as part of a 24-hour event. Our surgeons virtually collaborated using Microsoft HoloLens 2. Late last year, our oncologists used a brand new subcutaneous injection for treatment for patients battling breast cancer that can be delivered in a simple 5-minute injection instead of 3 to 5 hours needed to deliver the drugs in the form of an infusion. The Abu Dhabi 2030 strategic plan identified that the Emirate must take steps to attract and retain more highly skilled expatriate workers in order to move up the human capital value chain and to benefit their expertise. And with the recent introductions of 10-year visa and the announcement to issue passports are all a step in the right direction. And we are fortunate here that our visionary leaders are thinking far ahead and coming up with new strategies that can make UAE the hub of the next big innovation. Tied to this is a clear need to foster new skills within the healthcare and biotechnology arenas. Certainly in the UAE, the emphasis on STEM careers for students today is essential to meet the needs of the healthcare manufacturing industry of the future in the region and beyond. We must find more ways to encourage the younger generation to join us. Specific manifestations of this challenge are to establish self-sustaining biomedical and medical research infrastructure in Abu Dhabi capable of training its own workforce with world-class institutions focused on managing and curing specific diseases capable of serving not only its own population, but with the potential of providing solutions for the region. VPS Healthcare's decision to support students is rooted in the company's commitment to maintaining a highly skilled workforce that can help with the development of new and essential technology in the healthcare industry, while supporting the government's effort to increase the number of local graduates working in the private sector. Thank you for giving me this opportunity, and thank you all for being here today.
And thank you so much, Dr. Shamsheer, for your fascinating insights and perspective on the healthcare industry here in the UAE and internationally. It's truly a blessing to see such a powerful private organization hand in hand with the UAE government, with the UAE government institutions in terms of healthcare in this sector. We're really delighted to have you with us today, and thank you for sharing with us the depth of your insights.
Thank you.
And as a final note, we really look forward to the collaboration between VPS Healthcare and HCT's applied research, students, and faculty. So thank you very much.
Sure, thank you.
Ladies and gentlemen, that now concludes the 3 main keynote addresses on the healthcare sector. I'm sure you found them highly informative, thought-provoking, and engaging. And we really thank all 3 of our distinguished keynote speakers for generously sharing their valuable time with us today and for their enlightenment and benefit of this forum. We'd now like to turn our attention to the highly interactive and topical strategic outlook session on health. We'll have a distinguished panel of experts in the field of health who will consider and explore what are the most impactful health-related innovation trends today. They will also share their predictions on the topic of what will the healthcare sector look like by 2030. I'd like to advise all forum delegates that as per the program for today, there will be a virtual showcase of faculty applied research and student startups during the break time we will have after this. Without further ado, I'm pleased to introduce the session moderator, Mr. Wali Bremo, HCT's Senior Manager of Strategic Planning and Risk, who will introduce the distinguished panelists. Over to you, Wali.
Thank you very much, Khalid. Good morning to our audience. Before the pandemic, the healthcare sector had always been seen as ripe for innovation. With machine learning, technology companies have been using their particular strengths to break into the sector in order to produce valuable insights from the large amounts of data produced by the sector. As a result of the pandemic, governments everywhere have been having to rethink the role of digital technology in healthcare. In short, the pandemic has drawn attention to the complexities of delivering healthcare through the scaling up of human labor. Therefore, attention has been very much on technology-based solutions and innovations to address the problem. For example, in the UAE, Dubai is home to a thriving ecosystem of health innovation, with more than 60 healthcare technology startups located in the Emirate, according to the Oxford Business Group. These include Alhemeiri, a diagnostic telemedicine services provider that assists care provision in developing countries by connecting local providers to a global network of data and expertise. There is also AlTV, a digital healthcare platform that hosts more than 1.5 million pages of medical content and offers a 24/7 telemedicine service. Donor Healthcare is a Dubai-based startup that focuses on blockchain services for the sector, and Zest is an online app to help users pursue wellness and mindfulness. The Dubai Health Authority has been promoting digitalization in the healthcare system since at least 2013, when it launched Smart Healthcare Model to provide guidelines for helping providers to go paperless and increase automation. More recently, in March 2019, the authority launched a new appointments app and an update to its Sharian licensing system that uses artificial intelligence to register healthcare professionals and verify their skills in 5 minutes. These are just a few examples of innovations in this sector. And this segment of today's webinar is going to focus on 3 organizations and the innovations that they have been working on. First, I would like to introduce Huda Al Hashimi, who is the Head of Excellence and Innovation at UAE Medical. UAE Medical owns a range of hospitals and health centers in Abu Dhabi and Dubai, including Danat Al-Emirat Hospital and Health Plus health centers. Huda will be talking about innovations in clinical research in terms of the strategies that can be applied and the importance of establishing the right mindset and culture. Next, we have Dr. Rahul Goyal, who is a Senior Vice President of Clinical Engagement and Adoption at Malafi. Malafi is the region's first health information exchange platform, connecting all public and private healthcare providers in the Emirate of Abu Dhabi. Malafi enables real-time exchange of important patient health information between healthcare providers, creating a centralized database of unified patient records that is aimed at improving healthcare quality and patient outcomes. Next, we have Hanif Halak, who's the Director of Technology at G42 Healthcare. G42 Healthcare established a massive laboratory which was built in 14 days to address the need for population scale detection and diagnosis of various infections, and it is one of the first accredited labs in the United Emirates. Welcome to you all. Let me start with you, Huda. Tell me about the innovation that has been taking place at UAE Medical. Over to you, Huda.
Thank you so much. Good morning, everyone. It's a pleasure being with you and discuss very important innovation aspect in healthcare. And when we always talk about innovation, we think where we should start from. It should be the vision of the country we are living at, the vision of UAE towards supporting innovation in different sectors. And one of the key references we refer to usually is the Global Innovation Index. So in the year of 2019, the theme for the Global Innovation Index was creating healthy lives and the future of the medical innovation. That itself brought the attention and the spotlight on the healthcare industry, which means we have to speed up a little bit. Little we know at that point that around the corner we are going to have pandemic at the end of the same year. And if I have to talk about the types of the organizations and how most of the organizations reacted to the pandemic at that point, we had 2 types of organizations. Those who were having the innovation mindset and started reacting and bringing the initiatives forward, and those who started accepting and have more innovation appetite in healthcare. Danat Al-Emirat, at that point, since 2015, we had innovation in our mindset. It's part of the vision, the mission, and the core values. So if I talk about the 2 types of the organizations, what is the main success factors they are looking for? It should be sitting with the leadership direction. And it's good at this session, we are talking about the strategic background of the innovation in healthcare. Organizations that are having vision, mission, and core values supporting innovation tend to have better strategic goals, better uptake for the innovation initiatives, putting performance measures in the right place without forgetting that we have to measure the outcomes of the innovations. At UAE Medical, this is the scenario we are following right now. If I take you back a couple of steps, how we started framing what is the innovation strategy in UAE Medical and Danat Al-Emirat particularly, we ask ourselves questions like, what are the challenges we are facing today that we are trying to answer? And we know that IT, purchasing, facility, and operations in the hospital setting is looking forward, fixing main issues, starts with the access to care, the continuity of care, patient engagement and education, maybe a little bit on the diagnostic and on the infection control and tracing. During COVID and before COVID, we started looking at the telemedicine, mobile apps, chatbots to enhance the access to care and continuity and to ease the experience of the patients and make it easier for the patients to adapt and find the way to the hospital easier and to engage with the care providers at their own setting. When we talk about the patient engagement and empowerment, we have seen that the telecom consultations, and I would just go for a specific example at this point, and rehabilitation services. Little we know that rehabilitation services for pediatrics can be very successful in a telemedicine platform. When the child is in his home can interact with the physician without being distracted by the environment of the hospital or the noise. This was one of the success stories that we learned, how we can innovate in the service delivery for the patients, which can enhance the continuity of care, enhance the engagement, more empowerment for the patient regardless of their age. Then we look at the infection control, a key question that we are having usually in healthcare setting, especially in maternity and pediatric hospital where the population is very fragile, if I have to say. Two elements innovation supported. One is contact tracing and isolating the cases earlier, and at the same time, and the sterilization techniques that we use. This does not take the attention away from the diagnostic and tests that we were supposed to run at a very fast speed. Every day we were running more than 1,200 PCR results and put the results on Malafi. And I have to say at this point, thank you so much, Malafi, for supporting this interaction and taking huge data from our shoulders and making sure that safety and contact tracing was very successful. On the global level, what are the examples that we are looking at? When we are looking at the novel virus, we needed a novel vaccine for it. And at our level, we were looking and doing research at that aspect. And research also supported us to change a lot of policies in the hospital, the policies of quarantine, the policies of isolation, the policies of the visitors, the policies of which services are required today, and also help us enhance the patient experience at difficult time. When we look at the wider view of the innovations, we didn't forget that stress and anxiety was the killing factor for the society. So we put a couple of webinars and virtual counseling sessions for the patients and the visitors in order to make sure that everybody is benefiting from the services that we are giving on the wider society picture.
Thank you very much, Huda, for that very quick rundown, fairly detailed rundown as well. I want to turn now to Dr. Rahul. Can you tell us more about the work you've been doing at Malafi and the innovations there?
Thanks, Wally. Appreciate the invite to speak here. It's a wonderful scenario. Thanks, Huda, for segueing into Malafi with your comments. Malafi is like Wally you suggested before, is the region's first HIE. It's also sitting on the biggest healthcare data in the region at the moment and growing quite fast. So collaboration and working together is the DNA of Malafi, because all that data that comes from us comes from all the providers in the Emirate of Abu Dhabi, all clinical data pertaining to the patient's health, so that I, sitting in my clinic, can see what happened to the patient when the patient's care was happening outside my facility. How does that help us? It helps us analyzing the patient's state of health in a snapshot of a minute by presenting it in a very legible and focused manner, and then making fast decisions that can affect the patient's health outcomes. This was a blessing, especially during the COVID times starting 2020, because the patients were thirsty, and so were the doctors, to get results for things like the COVID-19 PCR tests. If you remember back in March or April, the time it took for a test to be done and the result to be declared was approximately 5 to 7 days. Malafi came in that space. We were able to get those results almost real time initially. So if a patient who was suffering with symptoms came to an emergency department, for example, the doctor and the patient don't have to wait for 5 days to get the result. They had the result, they could either reassure the patient to say they're absolutely fine, they don't have COVID, treat them symptomatically, or if you remember back in the days, we were admitting people with COVID positive results. So we could escalate the care, admit the people, and all that information was again being fed back into Malafi. So the fact that the patient was negative and the final disposition of the patient was connected with Malafi. And the other information that Malafi gave out was it had the aggregate of all these little clinical encounters that the patients have with their physician. We got requests from the regulators, from the commissioners, from the Department of Health to build them a dashboard where they could see all these little snippets on a dashboard to see what's actually happening on the ground. How many cases are coming up? Are the labs checking out the results as expected within the time frame expected? How long are the patients staying? We want to see how many people are actively positive at this moment in time. So all these dashboards helped drive policy and resource from the commissioner's end to help swiftly act for COVID. COVID was a very dynamic situation. I'm a family physician, and I know in my practice how things were progressing on a daily basis. We were reading about it so much. We were not sure whether the information presented to us was credible or not at that time. We were learning from people's experiences, but we needed information to act fast. So if in my clinic, I can see a patient's results, their risk factors, I can make quick judgment calls without wasting time. A picture says 1,000 words, and with your permission, I would like to just show a couple of dashboards that we did, which helped that decision making, if you like.
Please go ahead. Yeah.
Thank you. Hope you can see my slides here.
Yes.
The one I wanted to point out was this dashboard. Obviously, the data here is not real. It's all anonymized as well. The number of patients tested, the positive cases in the community, what's the length of stay. We could even break down to the gender, nationality, and age groups to look at which age groups are affected more. If there were the age groups that were above 60, that would require a different care group and commissioning compared to the other age groups. We were also able to present operational dashboards, like I was earlier saying, about how many patients were in quarantine, how many were, what was the average length of stay for these patients, and how many patients had a positive results with no follow-up, so that we could, from the commissioner's end, they could go back to the healthcare providers and say, guys, you have a number of cases here that need follow-up. It was a very good if you like, test and trace mechanism that Malafi helped enable, and the lab analysis of what was the turnaround time, what's the average turnaround time, what's affecting the turnaround time, and why are some facilities faster than the others. These are the sort of enablers, if you like, which we helped in getting to the right audience. So the audience in my case would be the commissioners of health services, the regulator, hospital providers, Department of Health, and the other end, the clinicians who are working on the ground, collaborating and making sure that we are working in a safe practice and avoiding uncertainties in clinical care. Thank you.
Thank you very much, Dr. Rahul, again for that succinct presentation and clarification of the innovation that you've been working through at Malafi. I'd like to turn to Hanif now. Hanif, at G42 Healthcare, can you talk to us about the innovation that your organization has been working on?
Sure, thank you, Wai. And thank you, Huda and Rahul, for very interesting sort of lead up. It's going to be hard to beat that, but I'll give it a shot. Again, Group 42 is known as an artificial intelligence and cloud computing powerhouse in the MENA region, having established the world's 31st most powerful supercomputer using state-of-the-art GPU and virtualization technologies, which basically amounts to a national resource for a secure cloud with supercomputing capacity. And of course, this is all within the distributed infrastructure to support cutting-edge innovation and also research within healthcare. And that's actually where I sit in G42 Healthcare. We also have divisions in security, fintech, energy, smart cities, transportation, and space technology within the UAE and with partners worldwide. Throughout and even before the pandemic era, G42 had launched top-in-class initiatives in healthcare, in particular the Emirati Genome Project, the EGP, which is among the largest globally, with a first phase of 100,000 genomes of Emirati citizens, with the eventual goal of 1 million genomes within 3 years. In addition, G42, of course, because of the pandemic, G42 is one of the first high-throughput PCR testing laboratories at Biogenic Labs in Masdar, where along with large-scale antibody testing, Biogenic Labs supports testing, vaccine administration, and disease surveillance, including sequencing of viral genomes to track both existing emergent strains and new strains within the COVID epidemiology. So this disease surveillance is done throughout the UAE currently, and also in partnership with neighboring countries that are sending COVID virus samples to the UAE at G42 Lab, the Biogenics Labs. And of course, this is going to help the country as well as the region manage the current and in fact also future pandemics and try to minimize their impact on the population and healthcare as well as the economies. In the future, we believe that interoperability of healthcare information systems, of course, Malafi being one of the premier HIEs in the region, and in Abu Dhabi in particular, with the current recent acquisition and partnership with Malafi, the Middle East's first healthcare information exchange system, HIE, we believe G42 and its collaborative partners and agencies within Abu Dhabi and UAE generally will be able to enable sharing of medical data. And this sharing of medical data in an ethical and a safe way, when that sharing happens, it will improve both public health, surveillance of disease, and impact on patients and their families. And of course, this requires putting the data together when needed, and then the kinds of dashboards that Rahul, of course, showed, which is not only health data, but in fact operational data with healthcare providers, so we can know that what can we do quickly and efficiently. And of course, at the end, it's about health before medicine, and if someone is already sick, then quickest care to them. We've also introduced the idea, not just in a clinical institution, but in fact, maybe even at home or when on somebody's own person, that if we can wear equipment like my iWatch, actually it became a health device. If I had some heart issues, this is actually something that Apple is working on right now. We would love to be able to, of course, take advantage of all these devices we're carrying with us everywhere we go, and we call it wearable technology. And in fact, the use of wearables in clinical trials is actually already started by providing participants in the phase 3 trial of inactivated virus vaccine from Sinopharm, the UAE. And we have this thing which it's called the Whoop band. And what it does is it monitors a variety of physiological markers, whatever it is, it's temperature, blood pressure, respiration, and these sorts of things. When we measure these things, of course, of people who have taken the vaccine, in fact, that becomes part of a clinical trial. So wearable technology is now going into not just people's hands, but into the clinic in clinical trials. And this wearable technology uses advanced signal processing and AI to analyze patterns in users and whole collections of users to warn them of any abnormal trends in their measurements. Of course, in order to warn them, we have to do studies in these clinical trials to understand what kinds of abnormal signals correspond with issues. For example, if someone takes a vaccine and they get a fever, or they even get COVID, then this is information where we can look back on the activity of that wearable, the Whoop band, and see if there's anything we can track in that activity, whether it's temperature, respiration, or blood pressure, or anything that might correspond with COVID response. And we can then build those signals and alerts into the system. And this is an example of the application of data and AI in a clinical context. And these are the kinds of projects that G42 would work with, of course, in partnership with clinical institutions, universities, and agencies and programs such as Malafi. Thank you very much, and look forward to the discussion.
Thank you very much, Hanif. Your three organizations represent, I think, a very key part of what successful innovation looks like. The fact that your three organizations are already collaborating. Collaboration is key, and I think any organization that is going to be working in silo is going to be less successful. And you've already, you're reflecting that collaboration effort here, and I think that's wonderful to hear. But my first question to all three of you is that collaboration has been very much centered around the sharing of data between your three organizations, and I think in any other part of the world, the first concern will be patient confidentiality with such sharing, such mass sharing of data. So perhaps the three of you, jump in freely as you wish. Just tell us a little bit more about that aspect and how patient confidentiality can be protected, going forward. So maybe Dr. Rahul, seeing that your organization is at the center of this collaboration, you can start off this particular discussion.
Thanks, Wally. Yeah. Yes, so if you ask any patient out in the community what bothers them the most about sharing of data, apart from the benefits that it brings, is my data secure? That's the first question that is asked, and the minds of the clinicians as well. So Malafi, if I give you the example of, is built on a very best-in-class and best practice structure where we ensure that the data of the patients is held in the most privacy-laden, bulletproof mechanism that you can ever imagine. We have separate connections. We have awareness sessions. We also have taken as an organization upon us to educate anyone working in our organization about HIPAA compliance. So there are mandatory and regular awareness sessions that we do, because we are a digital company dealing with patient data. We also have access levels for different end users, if you like. So if you are a physician or a nurse, your level of access is different provided to those who are working, for example, at the front desk. So it's a role-based access that gives another protection. That again is best in class and as recommended. The information sharing is always on the basis of need to know. Do you need to know this information? It is presented to you in direct congruence with your role. Also in our scope is protection of sensitive data. So our sensitive data is protected by another wall, which we have to actually break the glass to actually enter. So you have to again show a reason, and we have regular audits. We have regular audits to see who's accessing the data. Why is Wally, for example, a physician accessing 100 patients a day when he's only seeing 15? So these are the sort of audits and checks and balances that ensures that the data stays private. Apart from the technology, I think technology is one check, and culture and awareness of the people using the system is probably more important than that.
Thank you very much,
Answers a bit.
It certainly does. I don't know whether Huda or Hanif would like to add any more to that.
And I think I agree with Dr. Rahul. When we are identifying which kind of data in the facility we are using, whether the data is clinical assessment data or care planning, sometimes the data comes from the equipments that we are using, the devices. So first define which data, then define who needs it, for what purpose they need it, and then start putting the controls. And in my experience, actually, and I am a fan of a big data because it helps me to build prediction models and look at the safety perspective of delivering the care. And somehow also it supports in the efficiency. So we bring forward the IT team and discuss what is the needs, why we are doing this project, who is the partner on the other side. And recently, we started collaborating with DOH and many startups that are supported with COVID and Alliance to Fight COVID and Hub 71. And we learned from that how collaboration can be successful without having all the barriers around the data. We blind the data, we mask it, we put some filters and make sure that the right information goes so we can have the end product, whether we are working on early warning score system, for example, that supports in saving life, or prediction models, or even injecting AI to one of our processes to enhance the outcome. So at different scopes of projects, we learned that what, who, and how is the best way to transform the data.
Excellent. Thank you, Huda. And Hanif, anything you'd like to add to that hasn't been said already?
Yes, for sure. And again, this is mentioned already, that security, there's, I guess we could divide it into several layers. There's physical security of both systems. There's actually, we could call it data. There's actually data on paper, even on digital systems, and security of people accessing buildings and so on. So physical security, we have digital security, of course, networks, access to servers, logins, and passwords. But as was mentioned at least a couple of times, that it's really a security as culture, right? Of policies, guidelines, behavior, awareness. And again, this is something probably everyone has heard, that usually when security is compromised, it's often, it is at least as often that it's social engineering technique that we compromise security if someone was trying to get data that they don't have access to, as it is a technical problem or a technical violation. So of course we hear of hackers, all the time, and in fact it is an ongoing issue. It is rare that a hacker can get very, very far without some kind of relationship or some kind of called social effort. And so social media is and these kind of channels of communication end up being, routes of where monitoring, not just protecting, but also monitoring what's going on. So I think that's when it comes to, I don't know, every time I go into a hospital nowadays, more people know my birth date than I've ever told in my entire life. They're constantly asking what my birthday is, and I never get any presents. But the reason, of course, the reason that they're asking is to make sure that I'm the right person. So not only they're protecting, the process and making sure I'm the right person, that they're going to do the right procedure, they're giving the right medicine, but also so that the person that they're going to look at and talk to has a right to get the information from me and also have the right to then know the information they're going to tell me. This is also part of security and we'll call privacy. One of the challenges that people talk about blockchain, I'll just really quickly, that blockchain is actually not really, I would say that currently the technology that would solve a lot of the problems, because we're getting the data somewhere and you go to the hospital and the hospital put a blockchain, hospital already has a copy of the data. So a blockchain doesn't prevent or isn't secure if someone else already took your data and put it there. And so I think that probably in the future, one of the things that's going to come about is, we'll call it home devices, where we start to take tests, we start to take measurements and telehealth to where the data is starting with us. And then maybe blockchain can help with both giving us access to our data as well as protecting who has access to it. But for now, the hospitals, institutions, and Malafi is a great example of, it is very secure, but it is in one place. And that's why the security is so necessary. At some point, with blockchain, if one person gives their password away or their key away, then only that person's data will be, let's say, compromised. And so that's, again, distributing information is one of the solutions.
Excellent. Thank you very much, Hanif. Now, in the last 2 minutes that we have left, I want to talk about the future of innovation, the innovation that you have spoken about today. Huda has spoken about the innovation in terms of the access to care, the patient experience, contact tracing. We all know that COVID-19 created a lot of the pressure that led to these innovations for both for all of your organizations. Dr. Rahul, you've talked about the need for how you've used data for fast decision making, and obviously Hanif, you've talked about the sequencing of viral genomes with COVID epidemiology. Now, all of that has been sort of pressured by COVID, but at some point, COVID is hopefully going to go away. So, in terms of the medium to long-term future of innovation within your organizations, can you tell us just a little bit more, just literally, half a minute each, tell us about what the future is for innovation in your organizations. Let me start with Dr. Rahul in this instance.
Thanks, Wally. Brilliant segue into the future. So COVID, hopefully, I'm hoping summer will be gone. What it has taught us and what tools that COVID has helped us enable will help us in the future. I would say probably disease prediction of hotspots, outbreak prediction. where we can geolocate predictions, being able to put our resources there to snuff it out right from the start. Others would be presenting information to the clinicians, meaningful decision supports rather than spamming them with information, telling them about their patient's current status with the vitals that they have aggregated. What is the possibility of that patient staying in the hospital for longer than expected? What happens if I discharge my patient today as opposed to tomorrow? Is the risk of patient coming back to us higher? These are all aspects of data, clinical data, that we can layer on with machine learning, with AI, that Malafi can enable to present back to the doctors and give them the value add. And I think that's how we will tighten the system and give value for money for the healthcare provisions in the Emirate.
Thank you very much, Dr. Rahul. Literally half a minute, Huda.
And I think the future of innovation in healthcare sits with the complete digital transformation. Now we learned that the patients are not very willing to come to the hospital, and also it's more operationally feasible to go to the patient. So I see the future actually, the healthcare provided at your end, no matter where the patients are. And in order to do that, we are working on the mindset, making debates, workshops, and hackathons to enhance problem solving that comes from the employees themselves. Also, we are looking forward. There are two types of innovation, internal and external. We are investing more on the internal. So building the capabilities among the employees to do whatever they think can drive the innovation for their services. I think one of the challenges that we have conducted recently was design your own PPE. If the COVID doesn't go, at least we are prepared for any pandemic coming. This is where we are seeing the future.
Excellent, thank you, Huda. And finally, last but not least, Hanif, half a minute.
Sure, and again, I guess we could maybe not call it both COVID when COVID becomes like anything else, because COVID's not going away. It's going to become like that, a visitor. But I think surveillance, so not just for COVID, but any new, virus, bacteria. In fact, I think microbiology, and we have a project at G42 that we're trying to initiate for surveillance of the environment. It can be for both biological, chemical, and physical surveillance. And the idea that the Emirate can really focus on prevention and containment rather than responding to a pandemic to before it becomes a pandemic. And of course, we've had pandemics. In fact, if you could even say that cancer is becoming pandemic level of incidence, not quite prevalence yet, but it's and diabetes may be fast coming on cancer's heels. These are two diseases we have to, and I think there is genomics as a technology is going to be crucial, not just population genomics, but in fact disease genomics. We're going to taking tumors and early stage, in fact, what we call liquid biopsy. This is one area that G42 is focusing on is, of course, before we can prevent cancer, we have to detect it. And so that we can understand what are the early hallmarks of disease, whether it's, again, with a wearable, with, I think in the future, another thing that really to close, healthcare, Internet of Things, to where my watch, my bed, my sneakers, even my belt that I wear in my pants can become healthcare devices that are with me more than the hospital, the nurse, the doctor, and any database. In fact, what G42 has is a secure cloud where all the devices eventually would be able to monitor initially in studies, but eventually, hopefully, in population to where not only genetics, but we'll say activity can become a diagnostic.
Thank you very much, Hanif. So we've come to the end of this particular segment of this session, and I just want to take the opportunity to thank Huda Al Sheikh, Dr. Rahul Goyal, and Hanif Khalak for your time and your deep insights into the innovation that has been taking place within your organizations. Thank you very much indeed.
Thank you.
Thank you. We would now like to showcase the types of applied research that we have been conducting here at HCT. And we have 3 members of our faculty who will be presenting their research. First, we have Dr. Fezmi Majid, who will now deliver a presentation on spinal implants using additive manufacturing. Dr. Fezmi, would you like to share your screen and deliver your presentation, please?
Good afternoon, all of you. Assalamu alaikum wa rahmatullah. I'm here to present to you today our research, which is based on spinal implants manufacturing using the additive manufacturing technology, popularly known as 3D printing technology. So let's first see what the problem is. The problem is the spine degenerative disease, as I'm sure all of you are very familiar with it. It's symptomized by lower back pain, and the causes for it are age, sitting for a long time, or lifting of heavy objects. The current treatment for severe cases of the spine degenerative disease is surgical replacement using the standardized replacement discs. The problem arises because the standardized replacement discs, they are available in a variety of sizes, around 50 sizes, and they are manufactured by the normal molding method. So, as you're all aware, the human anatomy is very different from one individual to another, especially when you place these standardized replacement discs in the spinal cord. If there is any slight mismatch, it causes a lot of stress and strain on the nerves and the spinal cord itself. So usually, in some of the cases, there is mismatch because of the not correct accuracy of the standard and the human anatomy. And what happens is that the patient undergoes very severe pain and a recorrective surgery is usually required. So the solution that we suggest based upon our study is personalization of the healthcare industry. So what we are suggesting is extracting 3D models of the healthy disc from a human anatomy and then printing it using the additive manufacturing method. The findings based upon the commercial and technical viability study conducted by a project group is that it can provide improved patient comfort, better biocompatibility, improved preoperative planning, and reduced surgical complexity. We found that case studies involving patients has already been conducted, and the operations were completed as well at Netherlands and Australia in separate cases. Now, the major question here is this technology currently accessible for us in the UAE? We did had a lot of discussion with the Dubai Health Authority Innovation Hub, and we found that they do actually have the technology for extracting 3D models of teeth used for dental procedures, but they extract it from X-rays. So on our discussion, they said that extracting a 3D model from an MRI or CT scan would be much more easier and much more reliable. The impact of developing a manufacturing hub for spinal implants in the UAE would be on several levels. The first major impact is going to be personalized healthcare solutions. The second would be setting up a manufacturing hub in UAE, since there has been no other manufacturing hubs for additive manufactured custom designed implants anywhere in the world. And the major challenge to it is the initial financial investment required. The third major impact would be the reduced surgical wait times, since it's well known that internationally surgical wait times for spinal replacement surgeries is very common. The fourth major impact is no corrective surgeries, and this is the last but the most prominent impact of this project, if possible, because it would relieve the patients of much discomfort and much pain. The opportunities which a manufacturing hub would provide are on many solutions. First of all is the personalized health solutions. The second major opportunity is the training and employment opportunities for Emirati graduates in the fields of engineering, health science, and technical sciences like design. The other opportunities it will provide is attraction of scientists and researchers to UAE, and also we can expect a second phase expansion of the manufacturing hub to additively manufacture limbs and bone replacements which are required in prostheses and cranial surgeries. Thank you for listening to my presentation, and if you have any inquiry, thank you.
Thank you very much, Dr. Fezmi. If you'd like to find out more about Dr. Fezmi's research, her details will be available via the chat function. Now there will be a short 30-second poll to ask the following question. How would you rate the potential for commercialization of the research presented by Dr. Fezmi? So 30 seconds, please answer 1 for very low, 2 for low, 3 for moderate, 4 for high, 5 for very high. The results will not be displayed. The research that is rated as having the highest potential for commercialization will be announced post-forum. So 30 seconds to conduct this poll. Next, we have Dr. Fadi Abu Amara, who will now deliver a presentation on a hybrid virtual reality and robot-based social assistant for autistic children. Dr. Fadi, over to you.
Bismillahirrahmanirrahim. Assalamu alaikum. Good afternoon, everyone. My name is Fadi Abu Amara. Today I am presenting my research grant, a hybrid virtual reality and robot-based social assistant for autistic children. My research team members, Dr. Ziba Muhammad, Dr. Amir bin Sifia, Dr. Hatim Tamimi, Dr. Nasir Nasiri, and Dr. Aisha Bushdeb. First, let's identify the problem. Autism affects 1 in 146 births in the UAE. This is a high percentage that need attention. There is also limited research in using the robot and virtual reality as an effective treatment in this field. Also, there are high therapy costs in teaching autistic children. Also, developing a comprehensive solution based on robot and virtual reality to be suitable for the diverse autistic children. When I say diverse, we are talking about different ages from 4 to until 18. We speak about different autism degrees. Also, using a hybrid solution. Until this moment, still there is no full investigation. Our research findings until this moment. The integration of the robot as an educational tool is still in early stage to say this is a comprehensive solution that can be used by any autistic center. Also, using virtual reality in the autism need to be conducted in a controlled environment. Why? Autistic children have phobia of wearing the headset glasses. They may fall. So this should be considered. Also, developing an autonomous robot that can move free in the room without any help, without any remote control. This is a great challenge we need to address. Also, choosing the right methodology. As we said, we have diverse autistic children. So what is the right methodology? This is a challenge. Also, for each technology, choosing the suitable sample is a challenge. And also, we need to consider some parameters when we design an application to be suitable for autistic children, like the font, the color, the design, the timing. So these are screenshots from our developed mobile application. Here, they can choose indication or labeling. For each one, we have 4 prompts. For each prompt, we have 11 stimuli. And these are the categories we are planning to improve in the autistic children. The impact of our research grant. we are developing a mobile application based on artificial intelligence and using the now robot. Our goal to develop innovative commercial products to be used by families who have autistic children, to be used by regional autistic centers, also to provide community service for the autism field, and to develop standard practices. So what opportunities present in our research grant? Develop an innovative commercial solution that can be used by regional autism center, that can be used by families who have autism, can be used by the industry. So we offer research and financial collaboration between higher colleges of technology, between regional autistic centers, and currently we have a research collaboration with Mohammed bin Rashid Center for Special Education. So we support the region with AI-based solution to develop standard practices to be followed in the regional autistic centers, which at the end support Abu Dhabi Vision 2030. Thanks for your time. If you have any questions, let me know.
Thank you very much, Dr. Fadi. If you'd like to find out more about Dr. Fadi's presentation, then his details, as with Dr. Fezmi, will be in the chat, will be available via the chat function. Again, there will be a 30-second poll now carried out asking the following question. How would you rate the potential for commercialization of the research presented by Dr. Fadi? 1, very low, 2, low, 3, moderate, 4, high, 5, very high. And again, the results will not be displayed, and the research rated as having the highest potential for commercialization will be announced post-forum. Now I'd like to invite Tiago Caldera. Tiago is going to be presenting, delivering a presentation on 3D printed ventilator splitting and emergency ventilators in the UAE's fight against COVID. This has been a staff and faculty research collaboration for commercialization. Is Tiago? Is it Moez? Okay. I gather it's Dr. Moez next. Apologies. Now then, Dr. Moez, I want to introduce Dr. Moez Rekman, who will now deliver a presentation on HemiPhysio smartwatch apps, measuring upper limbs movements for physical rehabilitation in hemiparetic patients. Over to you, Dr. Moez.
Thank you. Assalamu alaikum and good afternoon, everyone. My name is Moizur Rahman and I'm faculty Computer Information Science at Dubai campuses. This applied research is about developing smartwatch apps to measure upper limbs movement for physical rehabilitation in hemiparetic patients. The app development I started in 2009 when I received HCT Seed Research Grant. Hemiparesis. Hemi means half and paresis means weakness. Hemiparesis is mild to severe weakness in one side of the body caused by brain injury, stroke, trauma, or cerebral palsy. As you can see in the figure, if the brain injury is in the right side of the brain, then it affects the left side of the body and vice versa. The most common symptoms are impaired motion functions. The muscles on the weak side become tight and therefore limits the free movements or volunteer movements of limbs. The weak limbs make the daily physical activities such as eating, playing, walking difficult. The focus of my work, my research, is to improve limbs weakness and specifically upper limb weakness in hemiparetic children. So here are some of the serious permanent challenges for parents, for patients. First, about children. The children require regular physical and occupational therapy to gain muscle strength. However, due to lack of motion awareness in the weak side, the children tend to use only the healthy or normal side in their daily activities. So therefore, their parents or caretakers have to remind them to use the weak side or affected or involved side as well during those activities. And this is a big task for the parents or caretakers. Also, currently, the parents monitor the rehab progress without technology support, which is another great challenge. Now, solutions and findings. So this is very preliminary research, very preliminary work. So to find a problem solution fit, we have developed HemiPhysio apps. So I'm calling them Hemi because it's for hemiparetic children. So we have developed apps for Apple Watch. The reason for choosing smartwatch is its constant contact with the upper limb, and reason for choosing Apple Watch is its advanced technology and features. Our apps use watch built-in motion sensor and machine learning, which is AI, support to track and recognize upper limbs motions. On the left side, you can see HemiPhysio data app, and on the right side is Hemi Rehab app. The HemiPhysio app data can collect sensor data of daily activities like eating, walking, and the range of motions for the weak as well as for the healthy upper limbs. We use this data to study the movement differences in both sides, normal and weak upper limbs, and to create machine learning models. So far, we have focused on 3 core motions related to elbow, shoulder, and wrist. Usually, these parts in upper limb have tight muscles in the hemiparetic children. From the collected data, then we trained machine learning models to use in our second app, Hemi Rehab. And remember, both apps are for Apple Watch. The Hemi Rehab continuously reads data from the sensors, and uses the trained machine learning model to recognize or identify those 3 motions. For example, when child wears the watch and starts the app, so app will start recognizing those 3 motions. As soon as app identifies a repetition or a rep of any of 3 motions, it will count it towards exercise goal. So with these 2 apps, we have tested at least smartwatch technology to provide some solution, means not complete, to the challenges mentioned earlier. So now what are the impacts? So you can see impacts on patient, parent, caretakers, health professionals, and app developers. This applied research can benefit many. The most important impact will be on the children, on the hemiparetic children. The app will make children independent in completing their daily rehab task by giving them notification through haptic feedback. These are all features in the Apple Watch. In addition, the app will remind them to use weak hand and arm in doing physical activities. As the children become independent, this will be a great relief for the parents and for their family caretakers. The caretakers will just need to set and monitor the daily physical rehabilitation plans. With apps, the physiotherapist, occupational therapists, they can now create, monitor, and adjust the rehab plan based on the real data from the children. The researchers or rehab researchers, they can use sensor data to study differences. See on the right side, the upper figure shows the census data of from the weak arm, from the involved, and the lower figure shows the sensor data from the normal for the elbow extension and flexion. And we can clearly see that the sensor data is showing that the difference in the movement patterns. Opportunities. like I said, that research is still very preliminary. We have great opportunities. Right now, we have not involved any professionals, caregivers, or we have not tested these on actual patients. So I conclude my presentation with future work and opportunities. There is a lot of work ahead to develop rehab and self-care apps that are customized and scalable. So first of all, smartwatch is like a powerful computer, and we need to understand this. So it's a powerful computer on wrist with capabilities of sensing and machine learning, AI. Stroke affects like stroke or the trauma, they affect also cognitive functions as well. So we need to benefit from the advancement in smartwatches and wearables and develop complete solution for physical and mental rehabilitation. Secondly, we need proactive engagement from physiotherapists, occupational therapists, rehab researchers, motion scientists, special education schools. It's very vital to develop clinically approved apps. We have different patients with different, like temporary or permanent disabilities. Therefore, we need full range of watch-based solutions. By engaging all stakeholders, we will be able to provide complete and affordable solutions from initial assessment, like the type of disability, to improvement and recovery. So thank you very much. Thank you for your attention.
Thank you very much, Dr. Moez. If you'd like to find out more about Dr. Moez's research, his details will be available via the chat function. And again, there will be now a short 30-second poll to ask the following question: how would you rate the potential for commercialization of Dr. Moez's research? So before we move to the presentations by three of our startups in this sector, I would like to introduce Tiago Caldera. Tiago is a member of staff, and he's going to present a presentation on 3D printed ventilator splitting and emergency ventilator, the development of emergency ventilators in the UAE's fight against COVID. This has been a staff and faculty research collaboration for commercialization. Over to you, Tiago.
Hi, good morning, everyone. It's been a pleasure to join this InnCuVation Forum and to present such interesting project that, like you mentioned, was a collaboration between the different incubation spaces, but with a key participation with very key faculty within the across the system in HCT. So this research essentially happened on the worst months of COVID. So between March and July, we were all in lockdown, feeling that it could repeat situations worldwide. So a very interesting team, led by Nicola, but counting with Dr. Nizam, Dr. Saleh, George, Solomon, Afiz, Michael, and Mahmoud. This team moved forward and collaborated towards the creation of two projects that could help on the emergency scenario in UAE. So in order to introduce the problem, again, we've been talking about Corona in the last in the last year, so everyone is already quite aware. But to put it in context, within this time, more than 100 million people got infected, and it killed more than 2.4 million worldwide. So it became quickly one of the most deadliest diseases in the world. Is already on the top 10. Of course, we don't have the exact data because to have a comparison, 2017, where cardiovascular leads as the largest cause of death worldwide. But with the 2.4, it's already in the top 5. And again, within the next few months, it could quickly arrive to become on the 4th place. And one thing that we notice, and we have examples from all over the world, but for example, US, Italy, that they suffered a lot with the shortage of ICU ventilators. We, within HCT, thought that we needed to act. And this is the project that resulted from that. So we actually had two approaches. Like I said, the team was divided in two main ideas. The first one was to have a splitter of the ventilators, which would be the design of a 3D printed splitter that would allow the same ventilator to be used by 2 up to 4 patients. And of course, to implement additional measurements to avoid cross-contamination. After that, we noticed that some of the locations, both locally or worldwide, we could even not have a ventilator to start with. So we needed to have a low-cost emergency ventilator that would act on ambu bag to actually provide the necessary flux of air to the patients. This could be built quickly, needs to be inexpensive, and be able to provide these sort of solutions worldwide. So we started working on it. Again, we were all new to the concept of working remotely. We didn't have access to our amazing labs, so we needed to use the free time of our staff and faculty that were on the project. And we started going deep on the ventilator itself. We started making some basic tests, and we start designing what should be the proper way of protecting cross-contamination between 2 patients. So as you can see, the splitter is introduced both on the air in and air out of the ventilator. And then from there is a set of filters and valves that would protect the patients. Additionally, there were additional sensors like the spirometer to measure the volume and a manometer to measure the pressure that would allow the doctors to not only rely on the information on the ventilator himself, but also to get additional information because, again, the ventilator was designed originally to monitor and provide feedback to the doctors of 1 patient. So additional information was needed to actually have the second patient and the anomalies between the 2 patients. And additionally, we noticed that this material needed to be something that could be used on a hospital scenario. So we used the PA12, which is a polyamide that it was printed by a selective laser sintering, SLS printer, and it's applicable for hospitals. And we also tested if it could be washed within the hospitals. Additionally, like I mentioned, we created the ventilator. So we tried to follow the overall standards in the market, and the ventilator was able to control a few of the key parameters. The respiratory rate, which allow us to control between 6 to 30 breaths per minute. We needed to control also the inspiration-expiration time ratio. This will be the time difference between how much time the person will be inspiring and expiring the air. And we could adjust it between 1:1 to 1:4. And of course, the tidal volume. So how much volume would be sent to the patient. And this is on the normal standards of between 200 and 800 milliliters. So this simple design, by controlling these 3 parameters, we would act on the ambu bag with a different pressure, different forces, resulting on a different patient outcome. We also created this device in a way that could be powered using the standard grid, 220 volts, but also with a typical car battery of 12 volts, having some tolerance to the 16 volts battery as well. At the end, we created 1 prototype, and we estimated that once minor production would start, we could have it below 2,000 dirhams, which was a key number when compared with a traditional ventilator, ICU ventilator, which is around 100,000 dirhams, or even if we can compare with similar solutions on that using ambu bags that are usually on around of 10 to 20,000 dirhams. The impact of this was quite great. We can see here the photo of Nicola within one of the ICUs. We actually went to different locations. This photo specifically is from Saqr University Hospital, but we went to different places in Dubai as well, in Abu Dhabi, in Al Ain, 2 hospitals in Al Ain, and we actually put it in practice. So we did tests with the necessary stuff. We released some information, and more important, we share the findings and the designs as open source so that the entire world could use the same concepts that we developed. And we prepared ourselves to be able to produce this kind of equipment or this kind of splitters quite fast. So eventually we will find out that we will be able to produce 1,000 units per week if an emergency would start using them, depending, of course, how bad it would be in terms of UAE or international. So in terms of opportunities, to conclude, essentially, after the initial works, we transmitted some of these know-how to one of the startups, Additive Health, and they actually got inspired not only by these, but they produced their own products. They're going to present next, and I'm not going to go too much on detail on there. But the other part is that we can also create new startups, and if other students are now interested on creating the ventilator or making it commercial, we could also move forward, and we can bring this information to one of our startups and help them to produce it and send it internationally. It's all from my side. I appreciate your time, and I hope that this presentation had inspired you and showed what we've been doing during these times of the COVID. Thank you very much.
Thank you very much, Tiago, and thank you very much to our faculty members that presented their research, and good luck with your presentations and your aspirations for commercialization of your ideas. This brings to an end the faculty presentations. Before we move into the final segment featuring 3 student startups showcasing their work, I would like to remind you to visit our InnCuVation Forum virtual showcase for a longer list of featured applied research that are contributing to innovation in the health, sustainability, education, and emerging technology sectors. You will find the link in the chat. The first student startup presentation will be by Halima Ali. Halima's presentation will be about additive health. Additive health provides 3D printing solutions to revolutionize healthcare by improving the work of doctors and patients' quality of life. It provides 3D printed models, prostheses, casts, and other rehabilitation devices customized for each patient. It also creates 3D printed equipment to support the fight against the current COVID-19 pandemic. It should be noted that the US FDA just approved the first 3D printed talus, which is the ankle bone implant. Over to you, Halima.
Hello, everyone. My name is Halima. I'm the CEO and the CAD designer in Additive Health. As you can notice, healthcare industry is advancing nowadays. And one technology that has not been used frequently is 3D printing. Sorry, I forgot to use my presentation. So additive health plays a role by providing and supporting the healthcare with the PPE products and more to enhance and develop the healthcare and take it to the next level. Furthermore, we noticed some problems such as the 2D images explaining to the patient their situation, and some of the traditional casts that might be irritating and impractical. So we designed customized biomodels to reach the satisfaction of our customers' needs. And we upgraded the traditional casts. We also had a chance to sell our around 800 units of our air savers, which are customized to help the healthcare department during COVID. After COVID, we are looking to help the healthcare departments by producing biomodels, customized biomodels and customized casts. and take it to another level, to avoid the traditional casts. Globally, 3D printing is a 3D printing market is growing by 26% every year, which will help us expanding locally and internationally. Our team have the capability to design and customize 3D 3D products, and we are also adapting to changes in market and to changes in market and our customers' needs, such as our COVID products. Finally, I'd like to mention that we are looking to collaborate with the doctors for more testing and for our biomodels and casts. And we have like more healthcare support in future. Thank you so much.
Thank you very much, Halima. For further information, visit the Additive Health website. The link will be in the chat. Next, we have Mohammed Khalfan. Mohammed's presentation is about a Gallant pump. Pumping, this is about developing pumping solutions for sensitive fluids. The Gallant pump offers a trouble-free operation in applications where fluids contain solid or suspended particles. Pumping organic molecules, biopolymers, proteins, or living cells require gentle and smooth pumping. Knowing the requirements of the market, Mohammed and his team have developed a gentle pump with all the necessary accessories to let their customers do their job and not to worry about the pumping process. Over to you, Mohammed.
Okay. I will share the PowerPoint. So a Gallant pump is self-sealed valueless pump for biomedical and bioprocessing application. So the current technology, roller pump, works by continuous compression of flexible tubing that provides a self-sealed pumping mechanism where the pump fluid is completely isolated from the driving mechanism. So the problem is continuous tube compression causes fragment from the tube to leakage, okay, that damages crushing while pumping. So the products and service, the magnetic addition without tube compression prevent continuous leakage or crushing blood particles.
Mohammed.
Actually, I wanted to talk about spraying outside. That's why it's so noisy. So respecting for the prayer, I'll be muted until it's finished.
Okay.
So the product actually works in a magnetic actuation without tube compression. It prevents contamination, leakage, or crushing of blood particles. So the CVD simulation show very low stress levels in almost the entire pumping volume. And we have the marketing size. Okay, the global pumps market size was estimated at 95.05 billion in 2019, and the pumps market is expected to grow at a compound annual growth rate of text from 2020 2027. And the total in the financial is almost 1,000 dirham, 100,000 dirham. And this is our business model, okay? So the prototype preparation and testing, getting approvals and branding, advertising and marketing, and mass production. And the stages are mechanical construction of the prototype completed, prototype electrical and programming underway, gathering information about the proofs required for pharmaceutical and biomedical application. And that's it.
Thank you very much, Mohammed. Thank you for your presentation. And thank you, Halima. This is actually the final presentation of our startups for today. Again, I'd like to remind you to visit our InnCuVation Forum virtual showcase for a longer list of featured startups that are contributing to innovation in health, sustainability, education, and emerging technology. You will find the link in the chat. So this concludes this strategic outlook session. I'd like to take this opportunity to thank all from industry and government attendees who have attended this first day of the forum. I would like to now introduce the Inspire and Ideate session, which is geared towards students and faculty, and that will be starting at 1 p.m. Do you need inspiration for your health-related startup or applied research project? The Inspire and Ideate session will explore key industry trends in health, helping students and faculty envision high potential opportunities on which to focus their applied research and entrepreneurial ventures. The moderator will be Omar Medse of the HCT Startup Development Program. My name is Wali Brimo, and thank you for your time today. Thank you.
Thank you so much, Wali. And we will be taking, as Wali said, a short break, just to let you guys stretch your legs. So 20 minutes from now at exactly 1 p.m., we will be starting our next session. So see you then.
Hi everyone, my name is Omar Mizher, and I'm very excited to work with you in our Inspire and Ideate session. First off, I would like to thank everyone that's here present today, our distinguished guests that have been here today as well. And I would like to just thank HCT for providing us such an interesting and nice event, especially if it's during online. Today, we're going to go do a quick Inspire and Ideate session, and it's something that we've been running as part of the HCT Startup Development Program with our students that are engaged within us and are taking these different activities that we offer. And the major idea behind this session is to show the process of ideating behind developing a startup idea. And it's quite an interesting way of looking at different sectors and topics. And for this edition in particular, we'll be looking and discovering the healthcare industry. So for today, as I stated earlier, we'll be taking a look at the healthcare sector. And through that, we're going to try to understand the trends, the challenges that are out there as well, and the opportunities that we can leverage in order to find some interesting and engaging startup ideas. So to start us off, what we usually try to do is what we've also done ourselves is we look at the different healthcare sector drivers. And as you can see, there's at least 4 or 5, and I'm sure there's more out there, but we try to grasp the major items of it. So in regards to the UAE healthcare sector, we saw that one of the key drivers is there's a large shift in demographics, some disruptive technologies that are coming in. There's a lot of advancements in science, and then as well as patient centricity. And last but not least, the World Health Organization is something that also helps us drive these the healthcare sector itself. So for example, disruptive technologies such as emerging tech have been able to help us create or drive us towards creating and developing solutions that leverage high tech in order to enhance accessibility, for example, for healthcare. While other organizations such as the WHO, they help us provide a very nice accessibility to understanding the global health needs and what areas we can focus on in order to allow people to receive the optimal solutions for their health needs. And it also helps us understand where we can focus and where we can innovate and where we can actually provide and create solutions. So after understanding these drivers, you tend to see more and more items moving towards the trends. And some of these trends, as you can see here, help the transformation of the healthcare sector. And when things start to transform in alignment with just global movements such as the fourth industrial revolution, or Industry 4.0 as they've coined it, you see some different components come together to help us create and visualize new solutions. So for example, some of the trends that we're seeing now is something along the lines of mobile health and personalized treatments and even some non-drug therapies. So for instance, in mobile health, we find the different solutions that can connect stakeholders through smart devices or mobile apps, or even the platforms online or on the computers. Personalized treatments, we also see that people want to find a specific way to help cure different types of diseases or diagnoses in a curated manner, basically. So for example, you can see the use of 3D or 4D printing, and you can also see the use of AI to help create tailored solutions for specific patients, rather than using the effective group therapy or specific solutions. Other items such as non-drug therapies are used to actually expand the prescribed lifestyles, where it's not really focused on just taking medicines, but it's actually helping people engage themselves through different types of therapies, which can also be digitally tracked. Furthermore, you're seeing a lot of trends that are heading towards genetic engineering and regenerative medicine. There, people are tapping into solutions that revolve around gene editing, bioprinting, exoskeletons that are enabled by AI, brain-machine interfaces, and also other things that are supporting physical conditions and disabilities through genetic engineering. Furthermore, what we also have been seeing is something known as precision medicine, which is sort of similar to along the lines of personalized treatment, but it's an approach that allows caregivers to select treatments that are very likely to help and support patients based on their genetic understanding of the disease. So essentially to find the right targeted medication rather than, again, providing a generic solution. And then furthermore, especially in this day and age, we're seeing remote digitally enabled proactive detection, where people are able to leverage data that will be analyzed by artificial intelligence, and it can help us take a more proactive role in early detection of abnormalities. So this way people can be more aware of their current health state and can actually find out the best solution for their current situation, their diseases, or their actual chronic conditions that they may have. So now that we understand some of the trends, we can actually jump into more specific healthcare sector challenges within the nation. So in the country itself, you see a lot of these different challenges that are displayed for you, where some of them are really interesting, and then other of them you see are some things that just require a little bit of research. So for example, we know that there's a population growth in the UAE, and it will cause the need to have more support and facilities for healthcare so we can meet the demand of all patients. Furthermore, there's a shortage of human human resources, where we need the appropriate amount of staff to support the demand as well. And then it has been monitored in the UAE in particular. We see an increased level of chronic disease risk factors, where things such as diabetes or even heart conditions are affecting the population, and even at a a higher rate than infectious diseases. And then once we take a look at these sector challenges, the concept is to have a thought. So we have these challenges in our mind, but how do we take it to the next step, and how do we address them? So in combination with what we saw in regards to trends and regards to drivers, now we can sort of start creating a dotted line between these three components. So how do we necessarily do that? That is the process of trying to find out how we can create a startup in these specific areas. So before we jump into the solution of how we create these startup ideas, I want to take a look at some startups that we've seen around the world, actually. So the reason why I bring these up, it's because I wanted to show that regardless of where we are, whatever it is that is out there, such as digital advances, technologies, IoT, AI, they can be used through different means to solve specific problems, and they don't have to solve the bulk of a problem or the bulk of a challenge. They can solve specific parts, and it can make large impacts for different people. For example, here, there's a startup called Page, and it's developed for the AI native digital pathology ecosystem to accelerate the transformation and discovery of the treatment of cancer. So just thinking of it from that perspective, you see that solutions can be developed from a very simple concept to business idea and help support the healthcare sector and provide different gateways of healthcare and treatment. Furthermore, while things are interesting for end users such as patients, there's a startup actually that came up with an idea to create a social platform for healthcare professionals. That way, these professionals can be able to support each other with different cases, provide advice for each other, manage different prescriptions as well to compare notes and contrast. And that's what Doximity is actually. It's actually stating that over 70% and 45% of the doctors and nurse practitioners are members of this platform. And it just allows these professionals to read the latest about the current state of their facilities, their cases and whatnot, and exchange notes with one another. And also, they have created something that supports this component of the social connectedness, which is the telemedicine application that comes alongside Doximity. And you can hear patients can actually interact through calls, text, or video sessions with the different healthcare providers. So it makes it a bit more accessible for people, especially the ones that cannot come to and cover long ranges of travel. And last but not least, we see something called Hinge Health, which has created a specific digital platform to help manage the back and joint pain for the different people that are facing these issues. Here, they provide contents for the different people that, such as videos for them to just help manage their back and joint pain. And they can also provide one-on-one health coaching for these people with acute and chronic pain to reduce their costs and increase their qualities of life. So now that I've shown you these startups, it's time to sort of take a step back and again, connect these dots like we first discussed, and maybe think about how we can combine these items together. And then we can sort of begin developing the different types of startup ideas aligned with the sector challenges, especially where there are ones that are challenges within the UAE context. So when it comes to our startup ideas, if we take a look again at our challenges, we can also see how we can leverage the different opportunities there. So our challenges here, it's the rising costs of healthcare, the increased levels of chronic disease and risk factors, and then the ability to manage healthcare during the post-COVID-19 crisis. So these are sort of our challenges that are actually putting us in our current state at the moment. And then we jump into understanding what opportunities in regards to the trends that we discussed, how we can use them or leverage them to create opportunities for the future and startup ideas. So these are two of the four components that you see within this page. And there's, besides getting the business concept, what we also need to take into account is who are our stakeholders here. By understanding our stakeholders, it helps us understand the feasibility of our business concept, and maybe it can help us reshape a business concept that was once at a specific place but needs to reach another point. So these are four critical components that we should take into account when beginning the ideation phase of our startup. So if, for example, we take the challenge of rise of costs of healthcare and combine it with artificial intelligence, we can have a potential startup idea where we develop a virtual care application that automates patient management, and it enables identification and digital triage of higher level of care for high-risk patients. So that's one startup idea. And then if we jump into the second row over here, we see that with the challenge of increased levels of chronic diseases and the risk factors, maybe we can intersect it with the opportunities such as machine learning. What would the startup idea come out as? Where we can develop a software for rehabilitation centers that allows telerehabilitation for treating people post-operations and even remotely, and at the same time providing them with real-time and interactive services. And then last but not least, when we're considering the post-COVID-19 crisis healthcare management and the quantified self, which was one of the trends that we discussed earlier, maybe we can find a solution by developing a smart sleep tracker through a mobile app, which enables the development of personalized therapies and detects and analyzes by the use of sensors of the various aspects of how you sleep and how it's affecting your day-to-day life and how you can improve it. So the idea and the notion of building these startup ideas comes with that linkage between the challenges, the opportunities, which is originally found by understanding the healthcare drivers, the sector drivers, the trends that are ongoing, and what's relevant for now. But for example, if we jump back in the sense where we don't incorporate something such as artificial intelligence, maybe it might be lost in time, or maybe it already exists. So this is why it is crucial to not only understand the challenges, but also understand the way forward, or sort of predicting the future, but it's not really predicting here because the trends are out there and the trends exist. So it's very essential to try to be forward thinking with these things and make sure that we're trying to capture something that's new, not necessarily groundbreaking or innovating, but something that will add, create, or deliver value for end users. And at the same time, while taking these all into account, we also have to see who are the third parties or the stakeholders in this scenario. Now, generally speaking, after looking at these startup potential ideas, we saw that there's various groups of stakeholders that should be taken into account here. And as you can see on the right column over there, definitely patients, so end users should be taken into account, doctors or physicians, people that are professionals with AI, customer user interface designers, hospitals, clinics, and healthcare facilities, as well as data scientists. So why do we need to take these people into account? It's because these people will essentially help us enable our business concept. So when we make sure that these ideas are to an extent validated by not only our research, but also by the critical stakeholders, we know that there's a nice and successful recipe for a startup idea. And that's how we sort of begin peeling the first layer of the onion for developing our startup. And this was a quick example of showing us how we can ideate around the area of healthcare. And I'd like to ask you if you have any questions or concerns, if you'd like to discuss them over the chat. Maybe we have some time for that.
I'd like to echo Mr. Umar's discussion at the end there. We'll have maybe the last 5 minutes where we can get the questions and answers. And then if you have any questions about the Ideate and Inspire sessions, how HCT is moving forward with conducting or nurturing these startups, you can ask any questions that you have.
So, Mr. Khalid, it doesn't seem like there's any questions, but before I leave you all, first of all, I'd like to thank you, everyone. I'd like to thank everyone at the HCT team and the HCT Incubation Spaces team. Oh, I think we got a question, if I'm not mistaken. Can people outside HCT participate in these programs? So, depending on what the boundaries is, but I'll explain to you how it works. Essentially, if you want to participate in the HCT Startup Development Program, you need to have a team member that's already at HCT and is a student there. And if they are, then yes. And if you're part of the team, then sure. But I believe you cannot enter as someone alone that has no connection or relation to HCT.
Umar, just a follow-up question. Since we have a lot of people here from industry, maybe not join into the startup development program, but how can they support the startup development program?
That's a fantastic question, actually. So again, thank you, guests, for being here. Really appreciate it. In regards to how they can support the startup development program, I mean, there's lots of ways. So as a startup development program, I don't want to repeat what Nicola maybe had mentioned earlier. We have a lot of activities. And these activities incorporate things like what I've just done today, but on a larger scale, which is the Inspire and Ideate. And as well, some things called the entrepreneurship talks. In the entrepreneurship talks, we try to identify entrepreneurs within a specific sector, and let's say in the healthcare sector, and they can tell us their entrepreneurial journey of getting from their idea from a startup idea to actual fully fledged business or to a grown healthcare facility. Whatever it is that they have, their entrepreneurial journey is always welcomed, and that's the whole point of this entrepreneurial talks. Second is Inspire and Ideate, when we jump into the ideation phase of understanding how to develop startups and build them from scratch. We usually try to bring in people like our guests who are industry experts and are key stakeholders, and they can tell us more about this industry and how they can, or what they're looking at for key challenges themselves or what they're trying to solve internally within their organizations. And then we actually run off with students where we have an interesting session and we help them ideate based on the challenges that were discussed by our stakeholders.
People are asking for a copy of the presentation as well, Umar. That seems to be quite interesting. Maybe if you would like to place maybe your email, Umar, in the chat, and anybody can just quickly get in touch with you regarding anything about the Ideate and Inspire sessions or the items that you have presented now.
Sure, definitely. So before I head out though, I just wanted to ask the audience if they don't mind. I'll share my screen quickly. For starters, sorry, I already sent in my email to the chat. Thank you, Khalid, for that. I just would like to ask for you as the audience and everyone that's there, not necessarily only the panelists, if you may jump into this QR code. You can use your phone. I know if you have an iPhone, you usually just open your camera app and just scan it. It'll send you to a link. If you're interested in any of the startup ideas that we've just discussed, which are here, please feel free to use this form and let us know your interest about it. Make sure that you select the topic of healthcare for today, fill in the appropriate information, choose a preferred startup idea. And if you have any other idea of your own, you have the space to also mention it as well yourselves. So please feel free, and we'd love to talk more with you if you have any sort of concept that you'd like to share with us.
Thank you so much, Umar. And just to let the audience know, within the following days, will they be able to also give ideas of the other sectors which we are presenting during this Innovation Week, right?
Yes, so for the next couple of days, we're going to have similar sessions where we're going to discuss the different startup ideas here. And yes, they'll have access to this form, especially with in alignment with the different topics.
Okay, great. I'd like to take this opportunity to thank you, Umar, and thank the team behind the Inspire and Ideate session. This brings our first day to a close, but before you leave us, we'd like to give you a quick peek on what we have in store for you tomorrow. So the first day covered the sector of healthcare. The second day is going to cover the sector of sustainability. We have quite an extensive list of well-known speakers tomorrow. They come from organizations such as the Ministry of Energy and Infrastructure, Expo 2020, ADNOC, Sharjah Electricity and Water Authority, and we have a lot of exciting topics for you. Some of these topics include the vision for food security in the UAE. They include the future vision of utilities, oil and gas, where are we headed with that, and how we're going to incorporate artificial intelligence in our sustainability efforts here in the UAE, and how we're going to support other countries as well to lead a sustainable future. Thank you for joining us for day one of the HCT InnCuVation Forum. And we will leave you with a quick presentation or a few brief slides for a few minutes, so you can see who the speakers will be for tomorrow, what are the topics they're going to be talking about, and if you want to adjust your schedule accordingly to join us for any of those topics. Thank you all very much, and we will see you tomorrow. Thank you.
you.